John conducted an intake interview with Chi-Chi. This was recorded and copies were provided to each of the therapists. So what you're about to see is an actual demonstration of clinical techniques, not an intake interview. John, can you give us a little background on Chi-Chi?
Chi-Chi is a 48-year-old single woman who comes from an Italian and Mexican heritage. Chi-Chi had some college, currently works as a professional writer. Now, she indicated that she has been in therapy before, and in the therapy that she took part in, she found structure very helpful. She found when she was given direction that worked really well, and that when she evoked emotions, and that became too overwhelming for her. When I asked her what is it that she would like to get out of therapy, what she'd like to leave, was she indicated that her biggest problem is setting goals and never following through on them.
Each therapist conducted 2 sessions with Chi-Chi. This DVD will include 1 session with each therapist.
Sometimes they chose their first session, sometimes the second session. Gary, can you set up for our viewers what exactly they should be watching as they watch our program?
The viewer will get an opportunity to compare and contrast 3 distinct forms of psychotherapy. Pay attention to the unique features as well as the common or shared features of these approaches. Don't try to judge which is the best, but pay attention to the similarities and differences.
And now, we'd like to invite you, our viewer, to watch the next generation of psychotherapy. Before we watch Les Greenberg demonstrate emotion-focused therapy, I have a few questions that I'd like to ask him about this approach. Les, welcome. Les, what is emotion-focused therapy?
Well, firstly, it's an experiential psychotherapy. So that means we really focus on experiencing rather than on sort of conceptual processing. So it's really not talking about your feelings, but really viscerally feeling your feelings. So emotion-focused therapy, clearly by its name, focuses on emotion. And it's saying focusing on cognition or behavior just isn't enough, although those things might be important. And then the hallmark of the therapy is that we have what we call markers, which our client problem states that they enter in the session. And then we have particular interventions that are appropriate at particular markers. So if somebody's in conflict, we use a 2-chair dialogue. If somebody is on the surface of their feelings, we use focusing and so on. So really...
So you do some assessment, and based upon this assessment, not a formal assessment, but a dialogue through dialogue?
Right, it's a process assessment or process diagnosis. What state are you in? Because intervention depends on the state you're in. And so we can sort of conceptualize emotion-focused therapy as islands of work on these markers or problems embedded in a kind of ocean of empathic attunement. So we see the relationship and empathy is very important, and the therapist's presence. So you really are in the moment. The therapist is in the moment. They're not thinking or theorizing, writing things down. They're really trying to be really attuned.
Now, you're known as the originator of this approach, and was there a theoretical basis for this approach or in your work that led you to this?
Well, really, this is an integration of person-centered, what we call client-centered therapy, originally Gestalt therapy, existential therapy, the humanistic therapies, and I really integrated those. And then later in the couples therapy, we also integrated systemic interactional approaches. So it really is an integration of those therapeutic approaches, but then it's integrated with emotion theory and sort of affective neuroscience. So it's an integration of those things. And also, I was a student of a neo-Piagetian, Juan Pasqualeone, and he had a theory of mind dialectical constructivism, and we utilize that theory to pull it all together.
I see. Now, most therapists deal with feelings. What makes this EFT approach unique?
Well, most therapies don't actually deal with the visceral experience of emotion and how to work with emotion as such. So we have a set of principles of how to work with emotion: awareness, regulation, expression, reflection on, transformation, corrective emotional experience. So we're really talking about how to directly promote emotional awareness and promote emotion transformation.
Okay, and so it's it's really then how you work with feelings. That makes
Yes,
this
it's how
approach
we work with
unique.
feelings,
Yeah.
and
The
that,
level, the depth.
yeah, right, and that it's empirically based, that we've, in a way, we've kind of transformed the art into a science in part, because working with emotion is so fluid and dynamic, and we've managed to isolate, measure in a reliable way, and so it's empirically based in many ways, and that's what makes it unique.
So this, when you talked earlier about these markers and then the particular strategy that you use, this has been tested.
Right, this has been tested, but also we have these different identifications of primary emotion, secondary emotion, adaptive, maladaptive, productive emotional processing, unproductive, emotional arousal. And so we've developed measures of all of these and shown how they relate to outcome.
Now, when you work with a client, is there like a process you follow? Are there steps? Are there stages?
Well, there's sort of circularly organized steps, not a linear sequence. But if we sequence it linearly, the first phase is a bonding and awareness phase in which the narrative unfolds. The second phase is really the key phase of evoking emotion. Then there's transforming emotion. And finally, there's this type of narrative consolidation phase. That's a way of thinking of it as a linear phase.
Yeah. And earlier you talked about some strategies and techniques. Can you talk some more about what they are? You mentioned the chair technique. You mentioned...
Right, so, I mean, the chair dialogues are very important because they help to get to core emotion schemes. This is another key idea of what makes the therapy unique. So the interventions are being used to get to the core emotion schemes. So we might use a two-chair dialogue between two parts of the self in different ways, an empty chair dialogue with significant others, focusing on an unclear felt sense. Then we have an intervention called systematic evocative unfolding, and that's for when people are puzzling about a problematic reaction. It's actually, we've delineated about 12 different markers and interventions.
Yeah. Well, in a moment, you're going to be working with an actual client, and what's going to be important when this client comes in? What are you going to be looking for? Help our viewers get kind of a feeling for
Right.
what's going to stand out.
Well, really, I'm going to be trying to follow the core painful experience. We talk about following the pain compass, because the pain leads you to the core emotion, to the core need. So I'm going to be following the narrative, but I'm going to be following vocal and facial expression that shows me what people are feeling. Because I think you really have to feel things to heal them. And we've got to get to what the core painful emotional experience is.
So you have to feel things to heal them. Can you say a little more about that?
Well, another phrase I use is you have to arrive at a place before you can leave it. So I think to change fear, you have to feel fear. To change shame,
you have to get to know it.
you have to feel it. It's like we have to accept ourselves before we can transform ourselves. We've got to get to it experientially, because then it's open to corrective emotional experience or to a new experience. If we're just talking about it, it doesn't sink into the deeper core of our being. But it's like, so to make a feeling open to transformation, we have to feel it now in the room. Then we have to feel a new feeling. So we talk about the best way to change emotion is with another emotion.
Now, when the client is talking, what are you focusing on? I mean, you said you're watching a lot of things, but you know, people are going to come in. They're going to be telling about the presenting problem. They're going to be talking about the narrative, the story of their life. They're going to be talking about thoughts and feelings and actions and
Yeah. So really, I'm focusing on two main things.
Yeah.
What are you experiencing and what's your core pain, and what are the markers that are coming up?
Okay.
So markers always come up, and I'm following the the emotions and the painful emotions. And if they're positive emotions, that's good. I'll follow that too. But I do think you have to get to the pain for people who are troubled. And people in general avoid their pain. They avoid painful feelings. So I'm trying to provide a safe environment to help them accept, undo the avoidance, to tolerate the emotion. But just tolerating emotion isn't enough. You also need to transform. And that's where the idea of accessing strengths, internal resources that are emotionally based will help change the negative feelings by getting to these more adaptive feelings.
Can you talk a little more about the markers?
Well, markers are things like when a person has two parts that are in conflict. We call that a split, particularly a self-critical split. Another marker is when you have unresolved bad feelings that have lasted for a long time towards a significant other. And then there are problematic reactions when I puzzle about a reaction that I'm having.
And so there's a handful, or how many markers are there that would...
Well, we've delineated around 12 now, and we really see the possibility of this being an ever-expanding set of markers.
So that's not finite.
No, no. I mean, recently we're working on self-soothing and self-compassion as a marker for emotional suffering. And we've developed a whole set of new emotion narrative markers, things like empty story, broken story. And so we're looking at the way people organize the experience as they narrate them, and then how best to intervene when it's a broken story and so on.
Well, in the session, our viewers are going to see in a moment, what do you want to avoid doing? What do you want to make sure that you don't do?
Right. I don't want to lead too much. We talk about our therapy as being a sort of dialectic between following and leading. When you're working with emotion, it's like with people self-organizing processes. And I want them to self-organize. But however, I don't believe it's all up to my client. I believe we're co-creating together. But I don't want to lead the person too much away from their own experience. But I am willing to lead in a zone of development. Like I can be a half a step ahead of a person, but not 1.5 steps ahead. That's too far. And I don't want to over-influence.
Yeah, so it sounds like you're dancing really with the client.
Absolutely. I think that's the best metaphor. And really in sync. And I don't want to shame people. I'm very sensitive to validation and not shaming and not raising anxiety, because that just raises the defenses, the protections, and helps people to stay away from their feeling.
You think of a client that would be really good, client for EFT. What would that client look like?
I think first and foremost is somebody who has a capacity to form an alliance. Right? And then they would need to be able to collaborate or agree on the goal and the tasks of focusing on emotion. So they've got to be somehow open to the idea that emotion is important in their lives. They don't have to be highly skilled or deeply experiencing when they begin. And we have research data on this, that people who start off at low experiencing, provided they can form an alliance, they eventually increase their depth of experience. But there's got to be some ability to see that emotions are important. And this is where working with men is sometimes difficult, because they tend to stay away from their emotions more than women.
That was going to be my next question. Do you really work differently with men and women with this model?
Yeah. I think it just takes a longer time with men, and there's the same issue with different cultures. In the Asian cultures, for example, and it takes a longer time to build an alliance, to build the kind of safety that's necessary. But afterwards, we would work in the same way.
Maybe as a way to kind of sum up our conversation before we see you work, what would the ingredients be then for good therapy?
Well, we've really done the most research of any therapy on the process of change. So we've shown that, firstly, arousal of emotion at moderate levels, and it predicts outcome. So we've got to have some emotion aroused.
Some, but not too much.
Not too much. In fact, we've shown that in the best or most highly aroused session, about 25% of the time that people are talking about emotions, if they're aroused about 25% of the time, this predicts best outcome. If they're not aroused at all, they don't do well. And if they're aroused too much, it's not good either. So we've got to have arousal.
So that would be one ingredient.
Right. We've got to have reflection, the ability to turn around and make sense of emotion, or mentalize it, to somehow make coherent meaning and help it develop the narrative, in a sense. So we're not talking about getting emotion out. We're talking about arousing it and making sense of it as the kind of core processes. Then we've recently developed a concept of productive emotional arousal. And this is where people are mindfully in contact or aware of their emotion and able to symbolize it, reflect on it, are congruent, and so on. So it's the way people process their emotion that's important. So they've got to process their emotion in a productive manner. That's one of the key ingredients. They've also got to get to their core maladaptive emotions, their core shame, their core fear. And then they have to be able to access their needs. Accessing needs is very central in promoting change. This is like the healthy force within people, is their healthy adaptive needs. So these are the kinds of things that help the therapy to work.
So moderate emotional arousal, being able to process this, being able to get the feedback from it and make meaning out of it.
Right, right.
And then you have down being able to know what your core needs are.
Right, right. Well, getting to your core painful emotion,
Painful emotion.
and
the
then
needs, okay.
getting to your core needs that the emotion is telling you hasn't been met. Then once you get to the needs, you tend to, the person who usually becomes an agent, trying to get that need met. This is a way of mobilizing agency in people.
Well, now it's time to watch you work, and hopefully we'll see many of those ingredients in this next session.
Hopefully,
Thank you, Les.
right. Thank you. So, Chi-Chi, we've just been chatting for a moment, but I'm wondering how you would like to use this time. We've got 2 sessions.
Right.
And what you'd like to focus on, or how it can be most help.
I think the main thing that I'm concerned with right now is it's a problem that I have with following through on goals that I set for myself, things that I want to do. These are realistic, they're attainable, they're not grandiose schemes, but I seem to constantly sabotage myself. I seem to constantly not be able to follow through.
I see. So somehow getting in your way or
Yeah.
not following through.
Yeah, I just don't seem to have any self-discipline or self-direction at all.
So there's a kind of sense of wanting to do things, but
Yeah.
not just being able to get them done or
Yeah.
somehow.
Yeah, so I feel kind of aimless. I feel kind of, you know, I always have excuses, you know, for why these things aren't happening.
Yeah.
But I've run out of excuses,
Excuses,
and I'm not getting anywhere with the things that I want to do with my life.
Yeah,
So,
yeah. And what kinds of things?
well, for instance, I've always wanted to write. I write for a living professionally, but I've always wanted to do fiction, and I'll make a start at it, and but I never follow through. It just sits there.
Yeah.
I work, and then I just drop. I have wanted to just basic things like at one point I was taking very seriously being healthy and working out and doing all of that, and I loved it, and it was great, and I was doing really well at it, and then boom, just for no reason I can see, I stopped and gained back all the weight I lost all of the physical ability that I had worked really hard for a long time to get to, gone. Things like that.
Yeah. And what do you feel as you say that? I mean, it sounded like it was touching.
I don't know why I do this to myself. I get so angry and disappointed with myself
Yeah.
for not, and it seems to affect everything.
Thing.
You know, so yeah, I'm already getting all upset.
But you know, right, I see that. But this is really a place where you have permission to be upset,
right.
because to deal with that. Because I think somehow the upset is saying this is really important to me.
Yeah.
And you're saying I'm angry at myself, I'm frustrated, it really gets...
I tend to express my anger by crying too, which also annoys me because when I get upset with someone or with a situation, I start crying when what I really feel is anger, and I don't get that either. But anyway, I didn't mean to interrupt you, but anyway.
No, but that sounds really important. So you're saying that often the tears come out, but really underneath your feeling is anger.
Yeah.
Right.
Yeah.
And here, though, it's a complicated kind of anger, I think you're saying, because it's a frustration of being angry at yourself, or being angry that you can't somehow achieve your goals.
Right.
Or what I was struck by also was the sort of, like, suddenly I dropped them. Well, that was the health related. And I'm puzzled because I was doing it and then I just don't do it, right? But with the writing, it's more, I want to do it, but I'm just really don't get going on doing it.
Yeah, yeah. Or I get going, but I don't follow through. I get halfway through, and then I stop.
Right.
Yeah, all kinds of things like that.
Yeah.
You know.
But then your tears, I mean, your tears are very important, you know. And as you know, I've seen your intake interview, right? And, you know, I understood that there are I mean, often these blocks in our lives come also from a whole history of kind of who we are and what we feel about ourselves and so on. I mean, how do you understand the blocking or the not being able to get things done? I mean, you say you're angry at yourself, right? And you get frustrated, but that's kind of a reaction. I mean, what's your understanding, or how do you try to understand it?
I don't really try to understand it. I try to fix it. I try to
I see.
I try to tell myself, you know, enough talking about all these things you're going to do. Enough talking about it. You need to start doing it. I try to do it small steps, small. And nothing seems to work,
And as the tears come up, can we stay with them, right?
Okay.
I mean, what actually happens inside when you feel all this tearfulness? If you were to go to your body,
I feel like it's never going to change, and I'm always going to be this person that does nothing but talk about all these great things.
it's a kind of sense of hopelessness.
Yes.
Then I think you're
Yes.
saying, right? I just feel like nothing will ever change.
Right.
And then you sort of move away from that, either by getting angry at yourself
Yeah.
or, and as you say, talk about it, but it doesn't help. But
Yeah.
can we try to stay with the hopeless feeling, your hopeless feeling, right? Where do you feel it in your body if you can? Like, what's it feel like even now as you...
It's like almost like a tightness, like through my chest, and I would say all the way down to my stomach, almost like a sick feeling.
Right, so it's all here.
Yeah, it's all
right,
here.
Right. So if you could try and pay attention to that almost, and it may even help to close your eyes and try and describe that first.
It's like a sinking feeling.
Yeah.
It's like you're on like when you're on the top of a hill or a roller coaster and you're going down, that sinking feeling.
Yeah. Okay.
Except it's not exhilarating like a roller coaster
So,
is.
but yeah,
But that just, like I'm drowning, like I'm sinking.
stay with that if you can. And can you maybe even talk from that? I'm drowning, I'm sinking. I mean, this is the difficult feeling.
Yeah, I think that's the closest thing I can describe it to, that I'm drowning, that I can see a light, but I can't reach it, and I know that I will never reach it.
But it's like I can see a light, but somehow I feel like I can never reach it.
Right.
Yeah.
That it's up there, but it's
out of reach.
yeah, I can't get to it.
Yeah. And if you just stay with that feeling, right? It's like I can never get to it. Just let words come from that feeling, or let it go wherever it goes, and just follow the feeling that I can't quite get it.
Yeah, and then and then I just sink and I drown, and I never was able to
Get
to climb up there and swim up to the light.
Yeah. And that's this deep sense of loss almost, and hopelessness.
Yeah, it's like my life is just so, like I'm gonna die without doing anything in my life.
Yeah.
Like I'm not gonna do, what I was
Sort of destined to
destined
do.
to do.
Yeah. But it is that feeling, right, of it's all, my life's going to be over, and I'll never have fulfilled what I could have or wanted
Right.
to.
And yeah, and it's in so many different aspects of my life. Things that I feel passionately about, as far as certain things in the world that I want to change, that I'd like to be more active in, that I'd like to devote my time to, and I just feel like
It slips through my fingers.
Yeah, I
or
can't make it. It's like I can't. I don't know.
I just can't make it happen. I
Yeah,
can't.
and it's me. It's me. I'm the one who's not moving, who's not taking any steps, you know, and I don't know how to get myself.
Really moving.
Yeah, yeah.
And how long, when do you first remember having this feeling, or what? So there's this sinking, can't get going feeling, and I mean, has that always been there since early on in your life, or?
I don't know. I guess
I mean, maybe it's not easy to.
it's not easy to pinpoint
Yeah.
when. I've felt it more strongly in the last few years.
Yeah.
I guess because I'm older.
And things are kind of moving.
Yeah, I'm realizing that a lot of time has gone by and there isn't much time left. So I think I've felt it more keenly in the last few years.
Yeah.
But that's,
But it's hard to sort of pinpoint
yeah,
specifically.
right,
Right.
right.
So somehow it's just this feeling of I can't get myself going. I hold myself accountable, sort of, or
Right.
responsible.
Right, 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 right. And I can't blame it on anything external. It's all me,
Yeah.
you know.
But I guess it's sort of part of me wants to do something, but just somehow I never quite get there.
No.
And if we can talk a little bit more about the I don't get there. How do you think you block yourself or stop yourself, or what happens?
I'm not sure. It's always, well, I'll get to it later. I can't do it right now.
Yeah.
I have something else that's come up. There's something else that's occupying my time. It's usually bullshit, to be honest.
Yeah.
But it's a convenient excuse at the time.
Right. But so it's part of me just keeps seeming to avoid
Yeah.
getting it done,
Yeah.
right? Or
Yeah. Yeah.
moving away.
Right.
Because somehow, if I did it, or there's a kind of fear of doing it, maybe. I mean, does that make sense?
Yeah, I guess that's part of it. I guess. Yeah. Yeah.
But it's just a puzzle in a way.
Yeah.
Yeah.
Yeah. Yeah. That I always get in my own way. And I don't even seem to realize that I'm doing it till I look back and say, oh, yeah, that's what happened. So,
You know, one way to try to work on this might be to actually have a dialogue between two parts of yourself where
Okay.
we look, because it's like they're two parts. I want to do it, and either I don't want to do it or I stop myself
Right.
somehow, right?
right.
And are you willing to try this? I mean, it's a bit unusual, but I'll help you along with it.
Well, I talk to myself all the time, so maybe that.
Right.
Usually not out loud.
Yeah,
But,
yeah, we all do that. Right.
so I could try it.
So what we'll do is in one chair you'll be the part of you that really wants to do things.
Okay.
In the other chair, the other part, which we'll try and sort of clarify.
Okay.
Right. So I'm going to just need to move chairs because of the
Okay.
cameras, right? But
Okay.
so, which part are you more in touch with right now? As a part that wants to do things, or the part that says, oh, let's just drop it?
Probably the part that says, let's drop it.
Yeah. Okay, so let's come over
Okay.
here and be that part.
Okay.
Right. So describe yourself, if you can, to me at first. I'm the part that...
That says, this is, What's the point?
Yeah.
It's not going to make any difference. You're just going to screw it up again.
Right, right. So already you're saying to her, you're going to screw it up again, right? So let's, and that brings up some of the feelings, right? So see if you can see the, stay there.
Okay.
See if you can see the other part of you. Here's Chi-Chi who
Okay.
wants to write, right? Who wants to write a novel or wants to. Right? Do this to her.
Okay.
You're saying to her, what's the use? You're going to screw it up again.
Right.
Or whatever you do to yourself. See if you can actually see yourself there. And you, let's call you the blocker or the interrupter, right?
Okay.
Stop her from doing it.
Okay. You're just going to screw it up again. You keep trying this. You keep thinking this time it's going to be different. It's not going to be different. You're going to screw it up again. You're not that good anyway. It's ridiculous. I'm tired of hearing about it. I'm tired of you talking about it. Just give it up. Just give it up. Let it go.
Let it go, because you're not going to get it done. And you're not that good anyway,
Right.
is what I heard you say.
Yeah.
Tell her how she's not that good anyway, or why it won't succeed. Because there's sort of two parts. One is you'll not get it done, but the other is you're not good enough. So what do you say to her?
You're just going to be exposed for the fake that you are.
Yeah.
You're not. You're going to give it a half-assed effort like you always do. Give it up.
So you'll never, if you try, you'll fail.
You'll fail.
Right. So don't even
bother.
Don't even bother. Don't get to it. Yeah. Does that
That's that's
what you do?
yeah.
Change, if you will.
Okay.
What's it like when you get that? I mean, already the tears have come, but what's it like when you get that message?
You're right.
Yeah, yeah. But what's it feel like inside? Yeah, breathe. And really go to you, because what does it actually do to you?
It makes me feel small.
Yeah.
Small and helpless.
Yeah, yeah, yeah. And this is the painful feeling.
Right.
Let's try and stay with that, right? So tell her I feel small.
That makes me feel terrible.
Yeah.
That's
And
it's
then-
not true. It's not true, and I don't know why you're saying it. But we both know that that's not true. And maybe you're right to a certain extent, but I don't know. I can't, I don't have anything to say to it. I don't.
And what do you feel as you sit here?
You're right. I mean,
It sort of feels hopeless, or
Yeah.
you feel
yeah,
like giving up.
yeah.
Tell her what it does to you. It makes me feel.
Well, now I feel like I have no reason to make any effort.
I feel like, what's the use?
What's the use?
Yeah.
What's the use?
And then I just kind of retreat
Yeah.
almost, or kind of.
I don't want to have this conversation anymore, so we'll just drop it. I don't want to hear it anymore, so we'll drop it. And I just go away.
Talk about
I
the
would
going away. What does going away mean? Like just.
In my mind, I just walk away. I just go away from it, distract myself
Yeah,
from it.
yeah, yeah. So it's almost like escape or what's
Right.
yeah, I distract myself from it. Somehow I was just having the image of kind of almost shrinking away
Yeah.
and disappearing so that the
Yeah.
kind of
So that I don't have to hear it anymore and I don't have to deal with it anymore. You know,
because it hurts so
Right.
bad, or it's so undermining. Where does that voice come from? You'll never get it done. You won't amount to, or you won't be able to.
I don't know. It's coming from me.
Yeah,
It's coming
yeah,
from myself.
Yeah, yeah. I understand. But you know, often these are voices we've internalized
Right.
from our parents, or you know. And I mean, I don't know. You know, it's a complicated voice.
Yeah.
I understand.
Yeah. Yeah.
But let's go back over here, because
Okay.
this is, as you say, wherever it comes from, you do it to yourself.
Right.
So do it some more, because this is what you do.
Um,
So make her walk away, disappear.
this is ridiculous. This is just a joke. You're just a joke.
You're a joke. Tell her why she's a joke.
You're lazy. You have no self-discipline. You can't stay committed to anything. You,
Make her not stay committed. Because this is what I think you do it like you were saying. Make her not be able to stay. What do you say? I mean, I think this is where before, yeah, what were you going to say?
you can't stick to anything. You don't have what it takes. For whatever reason, you just don't. You've just never been able to do that. And
And before
you're
you,
not going to this time either.
Yeah. That's sort of like a second level almost. Before you were saying, if you expose yourself, you'll be shown to be a fake. Or somehow it's like you won't really, you don't have it. I mean, is that right?
Yeah.
Or what is it?
Yeah, you don't, well,
Or make her afraid that she doesn't have it, I think is.
you have squandered all of your talents, all of your potential. You've just let it all go. So what's the point? You're obviously not doing anything good with it. You may as well just go crawl off into a hole. Just crawl off.
Yeah. And what do you feel when you say that? And you, it's like,
Just dismiss it.
yeah, yeah.
Just
Yeah, and you also pull a face a little bit, right? It's like,
give it up.
give
Go.
it up. You're,
Just give it up.
right, but there's some sort of disgust almost.
Yeah,
Or,
I do feel disgusted with myself.
Oh.
I think all those things are true.
tell her, I'm disgusted with
I'm
you.
disgusted with you.
Yeah, yeah. And it's a double.
I have no pity. I have no compassion. This is entirely up to you. If you want to change it, change it. But you're not.
Right, so
It's not my fault that you screw it up.
you, but you.
I'm just here to tell you how it is. To be the voice of reality.
Yeah, the harsh voice of reality,
Right.
right? Because it's like dismissive
Right.
and disgusted
Right.
and angry. I
Right.
mean, that's what you'd said, right?
Right.
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 Right. So this is what you do inside,
Mm-hmm.
right? I write you off. I'm finished.
I'm done with you.
I'm done with you.
Right.
But really, underneath that, it's like you don't have what it takes, or something. You know, there are like two
Yeah.
levels to this voice.
Right.
One is I'm kicking you for not getting it done,
Right.
but the deeper kind of voice seems to be you can't do it
Right.
because you're not good enough. Or what do you say to yourself to sort of make her afraid? You don't have the talent? Or,
It's not so much that.
yeah,
I recognize that I do.
yes.
It's just talent isn't enough. you don't have any determination. You don't have any
Sort of discipline.
discipline.
That's right.
Right.
Make her not have determination or discipline. Now, you see, that's the. How do you do that?
It's just not in your nature, for whatever reason.
It's not in your nature to.
To follow through with things, to stick to things, to.
So I want you to be a part that makes her not follow through. How do you do it?
What is the use? It's not. Do you even know that if you do this, your life is going to be any better? It may not be. It may be that this is just the way things are supposed to be for you, and you shouldn't try to make things better. Just deal with what you have and with who you are, and try to make the best of that. And don't.
Wow.
There's no point. There's no point. It's not going to. It's not going to make a difference. Nobody else will care.
Say this again, right? Both of those. It's not.
It's not going to make a difference.
Whatever you do won't make a difference.
Won't make a difference.
And nobody will care.
And no one will care.
And where does that come from in your life?
I don't know. I don't know.
But something happens inside when I ask you that, right?
Yeah. Yeah.
I think.
Yeah.
Does this come from your mother, or?
In a strange way, my mother was strange about how she motivated me.
Yeah,
It was always very mixed.
Because mixed sort of catches.
Yeah.
I have talent, but what's the use? It's not going to get.
Right.
It won't get you what you really need.
Right.
Wow. What was the mixed that she did?
She would praise me very highly for things that I was good at.
Yes.
But she also felt that the things I was good at were not necessarily things that were going to be of value in life.
Yeah.
And then, and then she would say, well, that, for instance, I used to do acting. I always wanted to act since from when I was little.
Yes.
I was very much praised for my talent in that, but I was also constantly told that was not
Gonna get.
get me anywhere, and that.
So be that voice, and that's your mother.
Right.
So can you be your mother and?
It's great that you have this talent. It's, that's great, but it's not something you can have a career in. It's not something you should pursue. It's not something you should take seriously. It's not something that's, it's not a viable thing to think about.
Yes.
You need to focus on just getting a job. And, so there would be that side of it. I went ahead and did it anyway.
Change. Let's stay with.
Okay.
What does it make you feel when you get that? Right? You see, inside, there's a voice there that's saying somehow it's not worth it. You won't.
Right.
It won't make a difference.
Right.
But then
Right.
this is your mother saying, it's not a real job, right? It won't get you a real job.
Right. Which, is true. But,
Yeah.
Well,
But what's the feeling that it creates in you?
Anger was my initial
Yeah,
reaction,
yeah,
you know.
yeah. Can you tell her?
Well, I realized that it's a tough area to go into, but I think that I should give it a try, at least try it. And if I don't make it, then I don't. But I think that I need to at least try it.
And I'm angry.
Right? That you resist and fight with me on this topic all the time.
Right, right.
And that I feel like if I do this, I have to fight with you about it, and that you're going to be, you're going to constantly denigrate my choices and my decisions, and that if I don't make it, then you're going to say, I told you so.
Yeah, wow, wow.
But then, on the other hand, when I did have some success with performing, then
you supported.
then it's great. Oh, my daughter, the actress, and you know, well, if you're an actress, why aren't you in the movies like so and so? Why aren't you doing such and such? Why don't you, you know?
Yeah.
What?
Change, because this is her voice. Right, right, right. Yeah, yeah, yeah.
Oh, well, that's great, but it's not really that great because you're not in a movie.
Right,
And you're not,
right.
I don't see your name in lights, and I don't see you on Broadway. So it's really not that great.
Right,
Oh,
right, right.
look at so-and-so. She's an actress too.
So you're never going to be good enough.
Right.
Something like that. What
Obviously, you're not good enough.
Yeah. Say this again.
Obviously, you're not good enough. So maybe at this point, you should just give it up.
Right. Change. What happens when you get that?
I don't know what to do anymore. I don't know what you want me to do. I don't understand anymore.
So it really
all these mixed-
confuses. I get
Yeah.
confused, and
Right.
somehow
Right.
I imagine it kind of really deflates
Yes.
your sense
Yes.
of
Yes.
kind of excitement
Yes.
or possibility, right?
Yes. It kind of swings from, oh, you're great, that's great, to, well, but why aren't you doing this and that? You know, to, well, you're not that great. It's this swinging of these extremes that,
Yeah.
you know, yeah,
And it makes you feel what towards her?
furious.
Yeah. Can you tell her? I'm furious.
It makes me so angry that you do this.
Yes. Tell her again.
It makes me so angry that you do this that sometimes I don't even want to talk to you
Yeah.
because we're going to get into this conversation and
Right. And you can feel this anger now.
yes,
Right. Right.
yes,
Right, and
Yes.
you're not crying. You're not
Yeah.
crying. You're being furious, right? So I am
yeah.
furious.
And when she starts with that now, when
Yeah.
we're on the phone, I just end the conversation.
Yeah. Tell her, I'm not taking this from you.
We're not having this conversation.
Yeah.
We've had this conversation a million times. We're not having it right now. We either switch the conversation or I get off the phone. It's your choice.
Yeah. Yeah.
Or I walk out the room. It's your choice.
But tell her what you need or needed from her.
I needed her to show me how she became such a strong person, that I always have admired that about her. And
Tell her. Yeah.
I have always admired that about you. That is the one aspect of your personality that I probably the most wanted to emulate, but you didn't show me how to. All you showed me was
You're not getting it. You're not doing it.
you're not doing it, you're not getting it, but you didn't show me how you did it or how she thought she was, I guess. I guess she thought she was. I think from what she tells me, her mother was that way with her.
Yeah. Yeah. So tell her.
Your mother was that way with you. Your reaction, however, was to to say, I'm going to prove you wrong. And you did. You did everything that you set out to do.
To
You
prove her
fought
mother wrong,
very
yeah.
tough odds to do it. And you did prove it wrong. And I wish that I could do the same thing, but I've never been able to. You frustrate me at every turn because no matter what I do, it's either not good enough or it's good but not worth anything.
And
So I don't know.
And that left me feeling so sort of unsure of myself,
Yeah.
or so unable to
Right.
sort of really.
Right. Right.
And I needed what?
Pardon me?
I needed what from you?
I needed more guidance,
Yeah.
not just this swinging between criticism and praise. I
Yes.
needed guidance, not, when my mother criticizes you, she doesn't, let's just say it's not constructive. It's always very,
When my mother criticized me,
when my mother criticizes me, it's,
it's really destructive.
yes, it is.
Tell her about how it destroyed you.
You can never just say, look, maybe you should try this, or maybe you didn't do this the best way possible, or, maybe you need to think about this. It was always, oh, you're so stupid. Oh, you idiot. How could you think that? It's always just the most
Yeah.
vicious,
Vicious.
just
Terrible.
awful.
Yeah.
Yeah.
And that left you feeling so diminished,
Yeah.
right? But so, like, what was it like? What did it feel like when you got that? I mean, there's this face of contempt and ridicule. It must have been devastating.
It was. It was. Yeah.
What actually happened? What was it? What did you feel?
I would feel just rage, fury. I would scream at her, yell, just to get out all that.
Yeah.
Yeah.
But I imagine underneath the rage there was such hurt,
Yes. Yes. Yes.
right, that I just felt so
And fear.
fear. Yeah.
Terrible fear. Terrible fear.
Yeah. Yeah. Do you taste the fear at all now? I mean, as you recall this,
As I recall it, yes. Yes.
tell her what fear you felt, if you will.
Uh,
I just felt.
I felt like you hated me. That I couldn't believe that you would talk to me that way, that you would say those things to me, as if I was somebody that you hated,
Yeah.
not your child. It's somebody that you just hated.
Hated. It's like I felt so rejected, or
Yeah.
so unloved, right?
Yes. Yeah. Yeah.
That's not quite fear, though, but did you feel fear too? I felt fear of your violence.
Yes. Yes, I did feel
Yeah.
that.
But it sounds like the deepest thing was like not your child, like you hated
Right.
me.
Right.
So I felt hated.
Yeah. I did. I felt. Yeah.
And I needed what? I needed to feel.
Loved, accepted. I'm sorry that I didn't turn out to be exactly the way you wanted me to be. But that's,
I'm me.
yeah.
And I needed you to really love and accept me. Can you say that?
I needed you to not reject me because I wasn't
exactly what you wanted, and I didn't do everything exactly the way you wanted it to be, and that you didn't have complete control of me, and that you would be okay with that
I needed you to be okay with me.
with me. Yeah,
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 yeah.
yeah, yeah.
And what do you feel as you say that?
I think that she tried.
Yeah.
I think she really tried.
Let me make a suggestion. Change. Come over here
Okay.
and be her.
Okay.
Tell her, as her, I tried.
I tried, but you were so difficult. You were so out of control. You were so you were always going to do what you were going to do. You never listened to me. You never took my advice. You never, if you had done what I said and listened to me, you wouldn't have all these problems. You'd be much better off in all areas.
But in her inner world, it sounds like it was hard to control you.
Yeah, yeah. And I think control was really important to her.
Tell her it was hard for me.
It was hard for me. I do like to have things the way I like them. I do like to be in control. And you were, of my 3 children, the one that was wild and out of control and not amenable to that. And you were always getting in trouble. And I had to stop that. I had to keep you from just going wild.
So in some way, from her inner world, I was trying to protect you, or, I mean, were you trying to harm her, or were you trying
No. I never wanted to harm you. I wanted
to
to.
tell her that? Yeah.
I never wanted to harm you. I wanted to keep you from making mistakes in your life that could ruin your life. And I saw you going in these directions that were destructive. And I wanted to stop that. And the only way I knew how to do that was by trying to almost, like I had to scream at you to get you to listen to me. And
It's almost like I didn't hate you,
no.
but I couldn't really manage my own life,
Yeah.
or
Yeah. Yeah.
I couldn't manage.
Yeah. My mother couldn't manage her own anger. And that, yeah.
Can you tell her this?
I couldn't handle my own emotions. Having children was stressful for me, and I couldn't handle things that were somehow escaping my
No, my control,
Oh, yes.
or my sort of holding it all together. Yeah, yeah, yeah.
And that was the only thing I knew how to do.
Yeah, yeah. So we only have a few minutes left, right? But let's come back over
Okay.
here and see how you, as you, take that now.
I understand that, and I don't have any resentment about that. I understand that. I'm an adult now. I don't think that we need to dwell on that.
Yeah, yeah, yeah.
But I'm trying to move on from that. And part of my trying to move on from that means that my interaction with you has to be something that I control, because
Yeah.
I don't want all that stuff to come bubbling back up. So I don't blame her. I don't resent her. I think she did the best she could. I think you did the best you could. I don't feel like I have to bring this up to you or punish you for it or anything like that. But I do feel that I have to work with how that left me to the best of my ability.
Yeah, 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 yeah.
You know, it's, you know,
So it's kind of like a scar that I carry.
right,
I'm not actively blaming of you for
Right.
it now,
Right.
right?
right, right.
But I guess, part of this and what we're working on is like, you did need her acceptance back then, right? And part of therapy is kind of like trying to rework that and go back. And almost as strange as it may seem, sometimes one can change one's past by reliving it in the present. And by going back there as the child who needed her and actually being able to tell her what you needed and get what you needed in imagination or here, it kind of helps heal the wound.
I guess so, yeah.
That's what therapy is about in
Right.
a way, is trying
Right.
to rework the past and help to heal that. Because somewhere inside of you, there's still that little girl, I guess, who needs that acceptance
Right.
and needs the kind of you're okay, right? In a way, maybe we can continue to work on that, of how you can support yourself rather than
Right.
get in your way.
Right. Okay.
Yeah.
Okay.
Why don't you take a moment and just come back to yourself? Yeah. And, I've sort of said some things about what could be, but where are you now? How are you putting this together for now?
Well, I think it's interesting. I like the technique. I think that's, yeah. I think it's very helpful.
Helpful too.
Yeah.
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 So if you go back inside of you just now, just try and name where you are, or be aware of what you're feeling.
Somewhat more hopeful.
Uh-huh.
So, yeah.
And you can actually sense that, or
Yeah. It's all of this is stuff that I've never said out loud. So I think that part of it is helpful.
yeah.
Um,
Good.
so,
Yeah, and I think it is.
yeah. It feels different when you say it out loud.
Yeah.
Yeah. It's less frightening because it's not all just jumbling around in there.
Inside,
it's out.
yeah.
It's like
right.
it's
Yeah, and when it's out in the world, we can kind of
Yeah.
manage it also.
Right. It's like
sort
it's
of,
yeah, coming out of me there.
Yeah.
So it's interesting.
yeah,
Yeah.
good.
Yeah.
All right, so, and it's a lot of work, right?
Yeah.
I mean, emotional work, right?
Yeah, it is. Mhm.
Yeah. And I'm pleased that it's helped you to feel a little more hopeful.
Yeah.
And I mean, we'll pick up
Okay.
again when we meet again.
All right. All right.
Okay,
All right,
good,
sounds
good.
good.
Before we watch Nancy McWilliams demonstrate psychodynamic therapy, I have a few questions that I'd like to ask her about this approach. Nancy, welcome.
Thank you.
Just what is psychodynamic therapy?
It actually is a range of approaches that derive from early work by Sigmund Freud and then his colleagues and then his followers that emphasizes the unconscious source of mental and emotional suffering and the importance of becoming conscious of internal conflict to try to deal with that.
Can you talk some more about the theoretical roots?
Well, Freud was not the first person to discover the unconscious, but he linked it up with a particular kind of suffering that was called hysteria in his time, which now we would more call, I think, post-traumatic phenomena, in which he was very impressed by what they were learning about hypnosis and about unconscious aspects of behavior. And he found that if you encourage, he tried several different things, but if you encouraged people to speak freely about their feelings and thoughts and fantasies, actually it was a patient who taught him that, they would gradually get in contact with less conscious parts of themselves. They would see conflicts that had been unconscious, and they would start being able to solve their problems without developing unfortunate symptoms.
So how would you say this approach is unique among the various therapies?
You know, I think all therapies eventually discover some of the same aspects about human nature, so I'm not sure I can claim total uniqueness for anything about psychoanalysis. But certainly its explicit emphasis on unconscious factors in individuals and going on between two people is a central part of what analysts and psychodynamic therapists think about. And I think in terms of how we work with patients, there's a lot of emphasis on how the past gets reenacted in the present. In the here and now relationship, and that gets kind of deconstructed. And we emphasize also the conflict in people, that they want to get better and that they're afraid to get better. And so they try to get better, but they resist getting better. And we try to help them see the part of themselves that's resisting it and work through that.
Now, are there steps and stages to the work that you do? Kind of a process that you
Only in a
follow?
very overarching way. I think every therapy is different. I would say one of the strengths of the psychoanalytic tradition has been its attunement to individuality. But in a very general way, the first part of the therapy process involves trying to establish a trusting relationship, a collaborative relationship, one that is asymmetrical, of course, because the client is the one coming for help, but that's mutually collaborative.
Are there unique ways that you would do that in this approach to create that sense of safety, that relationship?
One of the ways would be to keep an eye on what might be in the way of this relationship feeling positive to the patient. Again, a focus on the resisting aspects of the person. If the person's had a bad experience with women, for example, if the mother was, let's say, cruel or negligent, I would be attending very early to demonstrating that there could be a different outcome of a relationship with a woman, with me.
Okay, so you start with this relationship, then what would come next?
And then there's a long or short, depending on the structure of the therapy, period of elaboration of what the client is suffering with an effort to deepen the understanding of that, emotionally as well as intellectually, over a period of time, and seeing how the core problem reenacts itself in various situations, but especially in the therapy relationship. And once there's an agreement between the parties that there's significant progress made, usually people then move toward a termination phase. Although sometimes termination is clear at the beginning if you have a 12-session contract for whatever reason. And there are some patients who I think are essentially lifelong contacts, even though they may not stay in formal therapy. Some people are pretty damaged.
This is a deeper approach in terms of your work. You go deeper inside the individual, and it's a longer-term approach?
Well, you know, it started as a very short-term approach. Like, you know, all the psychotherapies tend to start that way. They start with claims that they can help people very fast. And Freud did too. He would call it an analysis if you saw him for 6 weeks. But it lengthened as therapists ran into the complexities of people. And because it's the oldest of the contemporary psychotherapies, it's probably the one that does go on the longest. Depth is a kind of a funny metaphor. You know, what do we mean by that? Emotional power, or making deeply unconscious issues conscious? But I think one of the conceits of the psychoanalytic tradition has been that it's deep, and that we go the distance, and that it often takes a long time.
Now, you mentioned just a moment ago about the clients doing free association, just talking and talking and talking. Are there other techniques or strategies that you use in this approach?
We're more likely to look at dreams than people in other approaches, although there's some exceptions to that. We're more likely to encourage patients to talk about fantasy, and we're more likely to try to make them feel comfortable with the negative aspects of their reactions to us.
Now, this approach has been around for a long time, the psychodynamic or the psychoanalytical approach. Is there a research base that supports its effectiveness?
Yes. I guess the best recent article trying to put a whole lot of meta-analyses together would be Jonathan Shedler's article about the effectiveness of psychodynamic therapy. Hans Strupp found that earlier. It was implicit in Smith, Glass, and Miller. It's implicit in the Consumer Reports study. I have to say, the current paradigm for research is one that doesn't sit easily with a psychoanalytic approach, because the current paradigm really came from very important work by David Barlow to try to make the point that psychotherapeutic interventions are as effective as psychopharmacological ones. And so it came to be common to set up short-term therapies in which you took data at the beginning, you manualized what you did, you took data at the end, and compare them with drug therapies. And I think that's an interesting kind of work, and there have been a lot of studies that they call horse race studies, where you see, well, is this kind of therapy better than this, better than this? Using the symptomatic presentation and the sort of evaluation of that at the end. And I think the unintended consequence of that is to buy into a kind of drug company notion of what psychotherapy is about, that it's about just getting rid of observable symptoms, when so often what people come to us for is a kind of sickness of soul that's very complex, and it's not so much about just getting rid of their temporary anxiety. It's about self-knowledge. It's about the interaction of a substance use problem with their anxiety. It's about the interaction of depression with their anxiety. For me, the research literature that is critically supportive of what I do is not necessarily the horse race studies, which tend to come out with what they've called the dodo bird verdict, that all therapies work and all should get prizes. And probably the way they work has much more to do with relationship factors and personality factors than with so-called techniques. But the research on affect, on attachment, on neuroscience, on personality, on defense mechanisms, and we have 30, 40 years of research on that stuff, are very valuable to me and very consistent with my psychoanalytic metaphors and theories.
So it sounds like some of the more recent ways of researching psychotherapy is to simplify the process, and your approach leaves the complex process complex.
Yes, I think that's a really good summary.
Yeah. Now, in a moment, we're going to watch you work with an actual client. And what are you going to look for in the interview? What's going to be important?
I will be trying to feel my way into what kind of relationship starts to develop between me and the person. I'll be attending to not only what they're saying, I'll certainly want to feel what it is they're suffering with that brought them. But I'll want to experience how they're relating to me, not just verbally, but with their facial affect, with their body language, and what gets stirred up in me in response. In other words, their transference to me and my countertransference to them. So I'll be paying attention to subtleties, including a lot of attention to my own internal process, what thoughts are starting to go through my mind, what songs start to go through my mind, what feelings, what body sensations I'm sensing with them. I won't say much about this usually, certainly at the very beginning, but that's how I'm
So the
experiencing
relationship and monitoring yourself.
Yeah.
Now, are you going to pay attention to the history, the story, the presenting problem, the client's thoughts, their
All of
feelings,
that.
their behavior?
All of that.
Yeah.
It's kind of a myth that psychoanalysts take a huge amount of attention to just rehashing the client's history. But it is true that the history is very important to us to understand, and to understand with the client, because if the client doesn't understand the reasons that they developed a particular self-defeating pattern or type of suffering, what they're going to do is blame themselves or blame other people, and that's not going to get them anywhere. If they can start seeing that the way that they behave makes sense based on what their situation was as a young person, they can start forgiving themselves, not being so shamed, and in their prefrontal cortex, distinguishing between then and now. So we do spend some time trying to mine history, but we pay a lot of attention to that early so that we can make a formulation in our mind about this patient's troubles. And we also monitor it when we feel the history coming into the here and now relationship. When I feel a client behaving toward me a certain way, I'll start thinking, what in the person's history makes sense of the fact that they're suddenly wary of me or ingratiating toward me or hostile toward me or whatever I'm feeling? How do I understand that in the context of the person's life? Also, I'll be asking, have I done anything to make them wary or hostile or whatever they're feeling toward me?
Now, just like clients have these mistakes they make or these self-destructive ways of dealing with life, what do you want to make sure you don't do in your interview?
That's a good question. I don't want to foreclose exploration. I don't want to close down something. I don't want to assume that I know what the patient means when the patient says something. I want to help the patient continue to elaborate their experience, their story. They may have had an experience that I think is very much like an experience of mine. But I'll try to hear whether they may have experienced that differently. So I try very hard not to cover something over, close something up, collude with the part of themselves that doesn't want to go to a place that's really painful.
Right, okay. So you try to be with the person rather than put a label on what's going on or to try to categorize it and
Yeah,
understand it in their terms.
and I guess I try to pay attention to my own
Okay.
narcissism, because patients often tell
Yeah.
you how much you're helping them,
And that can be hard to.
and a part of you wants to say, yeah, I'm
good,
great,
good observation.
rather than
Yeah.
to say, well, what about the part of you that doesn't feel helped? Or do you have any negative feelings coexisting with these grateful ones?
So, what makes a good patient or client for your type of therapy?
Somebody who's curious about themselves, who's not too concrete. You know, some people really want a program, and that's not the strength of the psychoanalytic method. Although, you know, if you understand a person well enough, you can adapt to that need. But somebody who is curious, motivated to understand themselves, not afraid of attachment, or able to tolerate their fear of attachment and closeness, because a psychoanalytic therapist is going to get to see, if the process goes right, the ugly parts of the self, the needy parts of the self, the parts of the self that the person has a lot of shame about.
As a kind of a final question that might pull all of our interview together, what are the ingredients of effective therapy? I mean, what's going to make this work when you see clients?
Well, all the research literature, I mean, as it's been summarized by people like Bruce Wampold or Sidney Blatt, Stanley Messer, many other people actually, seems to suggest the conclusion that what's therapeutic is not a particular technique. The relationship is what's therapeutic. The person gets a different experience. They come in, they expect an old story, and somehow a good therapist makes that story come out differently from the way they thought it had to come out. And I think you can do that from any theoretical perspective, and I've always been impressed with the empirical literature showing that experienced therapists have much more in common than experienced therapists have with novices in their own orientation. So I think we learn over time to give ourselves over to a process that's kind of organic, and trust that it's going to go someplace. If we watch it and try to get in the way of it reenacting point for point all the bad stuff in the person's history, we can make it come out differently. We'll be a partner in this project.
Well, thank you so much for your comments, and let's move on now to see psychodynamic therapy in action.
Okay. Okay, Chi-Chi, we are back after a couple of hours. Catch me up on what you found yourself thinking and feeling after the session.
I was really just trying to process it emotionally and try to think about what parts of my past would fit into what's happening now, and I was trying to pinpoint, you know, which of those things would be the most significant, which of those things would maybe not matter as much, and just kind of trying to process it that way. I'm not saying that I came to any conclusions, but it was just a matter of trying to do that with it.
What stands out for you among the many things you talked about?
I think that you had some really interesting insights, things I hadn't thought about in those terms when you talked about the all the incidents of abandonment, of impermanence, those kinds of things. I guess I never really thought about things in those terms. And so it was interesting that that was how you saw it, and also your idea that I always seem to get to a certain point with something, and then either pull back or do something deliberately to make it stop working or being good or whatever. And I thought, again, that was something I had never really thought of it in those terms. I had always thought of it as, well, no, I didn't. That's just a goal that I never reached, that I never even really came close to. In other words, almost like it was doomed from the start. It was a failure from the start. So I was thinking, well, maybe there is another way to look at all this and to view all this that is easier to deal with and makes more sense. I don't know. I don't know. I mean, again, these were just things that were going through my head. It wasn't like I was coming to any deep, brilliant insight or anything like that. So.
Well, one of the things I've really been struck with over time working with people is that we all assume that our own family, our own history is sort of normal.
Right, right.
And for an outsider to say, no kid should be moved as much as you were to all those different environments and then attacked when she was difficult because she was reacting to all that. It can come as a complete surprise because although it would be obvious to anybody looking at from the outside, it's just your life.
Yeah, to me it was my life, and there wasn't anything that I would view as sort of really real traumas, like we didn't have a death of a close of a sibling or a parent. We didn't have divorce. We didn't have, those kind of things.
No sexual abuse.
No sexual abuse.
Horrible accidents.
Yeah, exactly. The things that you normally think of as being really, really traumatic, terrible things happening in a family. We didn't have that. So I guess, to me, I never put it in those terms of being something that could be upsetting and traumatic.
Yeah, if you ever get a chance to get to know a young child really well and you watch them respond to separation, especially the first few times they have a major separation like a move or going off to school or nursery school, it's very difficult for them. There are a lot of emotions involved, and how well they do with it depends a lot on the compassion of people who are helping them name their feelings. And that's what I think you missed. It wasn't even so much the moves themselves, although they were too many and too disorienting, I think. But I don't get the sense that anybody talked with you about how you felt about them. It was just what your family did.
Yeah. Not really. I mean, there was a few years ago, my mother asked me, she said, sometimes I wonder if it was really the right thing to do to move you guys around so much when you were little.
It hadn't occurred to her until then. That might have been a problem.
And it was, we had never had that conversation growing up. It was always just, well, this is what we're doing and this is where we're going. And and when she said that, I said, well, I said, I think that there were good things and bad things about it.
So you comforted her in her guilt.
Right.
She probably really had no choice about the moving, given your father's job, or at least some of the moves were probably out of her control.
Some of them were out of her control. When we were older, she went back to work and actually worked with my father, and so she did a lot of traveling herself. She did like all the traveling and all the moving and going different places. She really did like that. She said that was one of the reasons that she wanted to marry my father, because she knew that was the life that he had. I don't know if she realized how difficult it could be.
I doubt it. I think it would have been too painful to her to realize that.
Right. So I think, but it's interesting what you were saying, because it reminded me of when I was in school, in high school. I was in high school overseas, and a large number of my classmates were British. And I remember that, how so many of them told me that it was the normal done thing to do for parents to send their kids away to school at a really
Very
young
young age, yes.
6 or 7 or 8,
Yeah.
really young. And almost every one of them said that they felt like they could never forgive their parents for having done it, that it was so, that they felt so emotionally devastated by it.
Yeah.
And I remember being really surprised to hear that, because it was such a common thing. But
Yes.
they almost all had that same reaction. And they all
Yes.
said, I will never do that to my children. I thought that was interesting.
Yes.
But again, I think that parents don't think about that, or maybe they feel they have no choice. I don't know.
Well, I hear in your saying that a wish to exonerate your own parents, who you love, and who are probably doing the best they can.
Right.
But some parents do think about that, and some mothers wouldn't want to marry a man who would be traveling all the
Right.
time when they were taking care of very young children.
Right.
So, in a way, I think you're trying to protect yourself from the grief and the anger that someone should have known how hard it was on you. Although, I mean, from what I understand, the hardest thing is not necessarily the losses of the moves themselves, but two other things. One is how people dealt with it, whether you felt your feelings were expected, accepted, understandable, supported. And the other is what sense you made of it as a young child. And since young children they're egocentric, not in a bad way, but whatever happens to them, they develop sort of self-referential explanations of it. Like, my father died because he didn't love me enough to hang around.
Right.
Depending on how old the child is, they will develop these self-referential explanations. And I'm guessing that especially without people helping you with your feelings, you developed some sense that you were being punished because there was something wrong with you. Because once again, they're ripping you out from under your familiar surroundings, your friends, in some cases the availability of your father. And I'm thinking that has probably more to do with the problem that we want to keep our eye on, namely, why do you sabotage yourself when you start getting toward a goal? It's very hard to actually make contact with that part of the self that might feel like it's because I'm bad that these things happen to me and I don't deserve anything better. And I'm only guessing that that's what's there. But I wouldn't be at all surprised if that's underneath.
Right. Yeah, I don't recall having those feelings when I was little, about those upheavals and those. I mean, we didn't really talk about it. Like I said, it wasn't ever discussed. It wasn't ever, presented as, well, we know this is going to be difficult, but it was always just, well, this is what we're doing, deal with it.
Yes.
And I think, the other kids that I made friends with, grew up with, were in similar situations. So we were all, it was almost like it was normal, So I think people who grow up in the Army is probably the same thing.
Yes, I was thinking about military kids. I've
It's probably the same.
run into similar stuff. And it's the same, it's usually the same attitude on the parents' part. This is just what military families do, so, tough upper lip and
Right.
don't be a baby.
Right.
Right. It was, yeah, that was very much the way it was done. I think really the where it all sort of came to a head was when probably once I became as into the teenage years, 12, 13, that was when I really started acting out.
Sure.
At which, yeah, that's the age that most people do.
Well, not only
And-
that, but it's at that age that the peer group is so critical, and
True.
moving is traumatic at that age. It's horrible to be a new girl at that age. Whew.
Yeah. Yes, yes, yes. So that was, yeah, that was, although at that point, when we made that move, I actually was looking forward to it because we were living in the States and I was very unhappy here. So I was actually looking forward to going somewhere else.
It must have been kind of odd for you to try to adapt to a United States adolescent population that didn't have your background.
Very, very difficult. Very difficult. Almost impossible.
Yeah.
So it was, yeah. So at that time, I was actually looking forward to moving, and I was very happy with that move. But it was also, again, I think because I was an adolescent, and that was when I really started to, in a sense, start to break away from my family. But my tendency was to do it in a very dramatic fashion. So, and that was, I would say, really when things really got just constantly confrontational and just for
Yeah.
years. It
I
was
bet
like-
they didn't know how to deal. This is a
They
diplomat's
didn't.
family, right?
Right.
How do you deal with an angry, acting out,
Right.
promiscuous,
Yeah. Yes.
substance-using adolescent?
Yeah. It was
Not in the manual.
not in the manual at all. No, and not at all what what I had been. It wasn't like I came from they weren't substance abusers. It wasn't, So, but that was. So I think that was when it really became just a really untenable situation in a lot of ways. So,
Well, let me change the topic a little bit and go to where I felt that you had the most emotion when I watched the original tape of you with John Carlson. And that was around the loss of that relationship. Are you willing to talk about that and what that meant to you? I think that's connected with this instability.
For some reason, it's really hard for me to talk about that one. I can talk about all the rest. I can talk about the one I'm in now. I can talk about all the ones in the past, all my past disasters. But that one, I think the reason that one is so hard for me to talk about is because I really do think that was one where I really did.
Were you sabotaged it?
Yes, where I really just completely ruined it, and I don't think people should. I don't think it's healthy or good to constantly have a regret about something like that. I think you have to be able to move on. And I think I have. It's just that it's
Well, what comes through is not just regret, but shame. that you, at least that's what I'm feeling from you, that
Yeah.
you acted in a way that you feel mortified by in retrospect.
I do. I feel mortified by it because I feel like it was completely in my hands, and it was completely within my grasp to have made that work. And for some reason, I didn't, and I deliberately destroyed it. And
Are you willing to tell me what you did? I think one of the ways to combat shame is to actually say what's so shameful and see if there's another way to think about it.
I don't. I.
If it's too much, you don't have to go there.
No, it wasn't. It wasn't something I did that I'm ashamed of so much as. Well, I guess part of it is. I allowed. I feel like I allowed too many outside influences to make a decision for me that was not in my best interest. And I guess what I feel ashamed about is that I did that, is that I was a grown person and I didn't act on my own, in my own best interest. And that's what, when I look back, that's my regret. That's that I have no one to blame but myself. And that's the part that, is, and maybe I've idealized this relationship in my head too, but I don't think so. I don't know.
Well, I can see you struggling not to get into too many details. If I were in a long-term therapy with you, I would slowly try to get you to tell me all the details. But here's what I am putting together from what you've said so far. That growing up, all kinds of decisions were made for you by other people.
Right.
You had no say in it. You just had to cope. You had no opportunities to develop your own sense of agency, of having control over your own life. And when you hit your teenage years, you determined to live your own life with a vengeance
Right.
in a way that was self-destructive, but at least it was your self-destructiveness. You were in charge of it.
Right.
And so I find myself not surprised that you let other people influence you a lot, because I think there was a disturbance of your sense of agency. And in a way, it's a repetition of, listen, everybody else knows where you should be.
Right.
You should leave the guy. Or
Right.
We're moving.
Right.
And the only way you could feel your own sense of agency in that situation was to precipitate exactly what the loss was that you were afraid of. It's like a kind of acting out.
Right. Right.
But at least you did it. I mean, in some ways, I think one of the consequences of your history is that you can feel your power mostly in opposition to someone else's agenda.
Yeah.
And when you're headed toward the finish line in whatever it is, and you start feeling that some other agenda is now controlling you, you may need to throw a monkey wrench into everything. That's how I'm putting these
That's
things
interesting.
together.
That's interesting. Yeah. That's. Yeah. I think that's. I think that's what it is. And I think, but I don't know, because what am I opposing now? You know, what,
Yeah,
you know?
well, the unconscious isn't so rational.
Well, okay.
We do find ourselves, and that's really what you came in for. That you keep enacting something that doesn't make sense, and you're saying to yourself now, why doesn't it make sense? But in a way, it made perfect sense in your family of origin. That really was the only way that you could feel like you were living your own life.
But why couldn't I have done that in a way that was more constructive than destructive?
Well, you would have needed some help from the adults in your life to give you a slowly developing sense of agency, including maybe things like saying to you, we do have to move, but let's figure out what would be best for you given that we have to make this move. I mean, I think your mother with 3 kids probably couldn't sit down with each one and do that.
Right, right.
But some parents will very carefully do that. I know you're miserable about moving, but at least let's talk about how you want us to paint your room.
Right.
Whether you want to go to the public or the private school,
Right.
let's think about those things. I mean, that's how you help a kid get a sense of agency.
True.
And I don't hear that they did that. I hear that your father's job kind of dwarfed those ordinary family processing.
Well, yeah. They did let us pick what schools we wanted to go to.
Okay.
So that was, and that was kind of fun, and that was kind of, so that way we were a part of the process. But yeah, I guess, yeah.
Let me, I see you sort of struggling to make it fit. I may be completely wrong.
No, I don't know.
I'm throwing it out because
I know.
maybe it will really strike a chord in you and it will help you make sense of this, and there will be a sense that you can make of it that doesn't involve this self-critical,
Right.
I'm just an idiot
Right.
reaction that has been your favored way of dealing with it.
Yeah, and I mean, I try to think of things that are, you know, where I have been successful or where I have been, where I haven't seen that pattern play itself out. And I guess it's hard for me to say, it's almost like it's hard for me to connect those areas with the other ones, you know. And it's hard for me to have complete trust even that those things are really as good as they seem, or even as...
Tell me about some of those. What are the things that you haven't had trouble taking to their completion or being successful in?
I think that my friendships, I've been successful at having close friendships with a few people, and being able to have then a wider circle of people I wouldn't call friends, but acquaintances, people that provide a certain level of support and other positive things. Of my current relationship, I would say, has been successful, and so I sometimes think, gee, I wonder why I didn't manage to screw this one up yet.
Yeah.
You know, and I want to stop thinking that way because that's not a good thought to have in the back of your head. And, you know, work is a mixed bag. In some areas, I've done very well, others not so much. But, you know,
What do you think makes the areas of success different from the others? I mean, obviously you're anxious that they'll also go the way of the others, but does one involve men more, or does one involve, you mentioned weight, attractiveness, that could be related to men. Is there?
yeah, I mean, that's certainly, I'm certainly unhappy with my appearance because of my weight. And that is, that's a big deal to me because that was always something that, that was always something I felt really good about when I was younger, you know. I always felt really proud of my appearance, and now I don't. So that feels like a big loss too. And
No wonder you understood my feelings when I was upset with the
about the
makeup this morning.
that's right.
I felt this immediate compassion for me.
Oh, I know how awful it feels when you feel you don't
Yeah.
look good. And so, you know, and again, that's something that is up to me, and it's in my, I mean, certain things I can't fight, like time, but there are aspects of it that I can control, and that's a big one, and I'm not able to do that. And supposedly it's important to me, and I can't do that. So why, you know, why is that? You know, at work, I mean, I'm in a good position now at work, but my work life has been rather checkered, and you know, again, I would, you know, that's also something that's important to me, that gives me a lot of validation. And again, in the past, I found myself in situations where I was in a good job, and something would happen, and I would either quit or get fired. And, you know, again, this is supposed to be something that's important to me, so why do I keep not making it work?
And would you get fired because you had done something provocative or lashed out? We haven't talked about your anger too much, but you did mention anger in the...
that it would usually be related to something like that. Personality clash. You know, not knowing how to handle conflicts at work or problems at work, that kind of thing. It's like this little busy black cloud that keeps chasing me around.
I imagine when you were a teenager and when you were screwing up your life in certain ways, you probably had the same sort of voice in yourself going, why are you doing this?
Yes.
What's the, you know, why can't you just
Right.
you know, not throw your life away like
Right.
this?
Right. Yes, I did. But it just seemed like it was so important to just be defiant and to defy everything.
Yes.
And to
Well, I think you were angry, and I don't think there had been much room for normal anger in your family.
no, there wasn't. So I think I don't know. But now it's like I've worn all that out, and now what's left? You know, so
Well, let me make a recommendation and a prediction. The recommendation is, as I said earlier to you, I really think it will be valuable to you to have real therapy over the long term with somebody who could be there for as long as you want the person to be there. The prediction is that in a therapy like that, these patterns appear in the here and now. They're not going to appear between you and me in 2
Right,
hours,
right.
but you will probably find yourself feeling angry and oppositional toward the therapist and the therapy process at a certain point. And it's critical that you hang in there and understand that at that point,
I see.
rather than
Quitting
enact
or-
the same thing that you've done with other stuff. And that'll
Right.
be the responsibility of both you and your therapist to try to make it come out differently this time.
Right.
Because one of the things that happens in therapy is that there is a subtle repetition of the
I see.
serious emotional things from your life, and they can just replay unless you both parties are attuned to making it come out differently this time around.
So in therapy, the idea is for it to come out with a different ending.
Exactly.
This replaying.
Right. You can't expect yourself not to
Right.
find yourself feeling angry or hopeless or fearful that you're going to lose the relationship or the rug's going to be pulled out from under you. I think that stuff will come up a lot. But I'm urging you to hang in, because I think with a different ending, you could be re-educating the internal tapes.
Right.
I mean, you wonder why you do these things. We've learned over the past 20 years a lot about the brain, and the amygdala, it takes a long, it never completely unlearns something. It just, it learns other stuff that modify
Okay.
what it has originally put down. And that's what happens in therapy, basically. Emotional learning is permanent as far as we know, but what we can do to take it in a different direction is still really considerable.
Okay. So there's hope.
Yeah, absolutely. But it would really require an investment.
Right.
You know, it's not going to be something you'll get from a one-shot thing.
Right. Right. Right.
We only have about 10 minutes left, but let me ask you something I haven't asked yet, and that's whether you dream.
Yes, frequently.
And do you have recurrent dreams? Are there themes in your dreams?
There are recurrent dreams and themes.
How would you describe your dream life?
It's mostly actually very pleasant. I usually like my dreams a lot. Usually they usually involve outdoor settings.
Huh.
Usually water, oceans, beaches. People that I know.
You know, the first thing that came through my mind when you said water and ocean and beaches are things that don't change much.
Oh,
know.
interesting.
Natural, not that that's entirely
Well,
true.
yeah,
But it's not like
yeah.
moving from country to country.
Oh, well, yeah, that's true. Yeah, I rarely have bad dreams. They usually are, like I said, there's usually people that I know, people that I care about in them. They're usually in these beautiful settings. I sometimes think, I want to go back there. You know?
Yes.
Uh,
I bet you felt that a lot as a kid.
I
I
did.
want to go back there.
Yeah. But, so that, yeah, that's,
You haven't had recurrent nightmares or any?
I did when I was younger. I did when I was younger. I did, but that stopped. when I became an adult. The bad dreams I have now are I have dreams about I would qualify them as nightmares. They're dreams about people dying.
About loss.
Hmm.
Have you had people die on you?
My father.
That's right, 10 years ago.
Yeah. And it's more than that now. Yeah, about 10 years ago. And yeah. So
And what did he die of?
he had a stroke, and then he had a heart attack about a year later. The stroke really put him out of commission, and then he had the heart attack.
That must have been hard to see him that way because
It was terrible. It was terrible. Yeah. It was completely unexpected. He was very healthy, and but after he had the stroke, he didn't want to take care of himself. He didn't want to do the things you're supposed to do, or do his physical therapy or any of that. He kind of just gave up. And so yeah, it was tough. So
And did you grieve that?
yeah.
Did your family, were they able to grieve together?
Yes, we were, actually, and I gave the eulogy at his funeral, and it was, yeah, and a lot of other family members came for the funeral and spent time with my mother and with us. So yeah, we were able to. My mother had a really hard time with it.
I bet.
She took a very long time to.
I imagine
Yeah,
because
yes.
her whole life was an adaptation to
Yeah.
his life.
Hmm. And they'd been together so long,
Yeah.
and so it was really hard for her.
And you worry about her, you said, how is she doing?
You know, it's her. I worry about her physical health. I worry
Yeah.
about. It's funny. I was talking about it with a friend of mine whose mother has Alzheimer's, and she was telling me. She said, "Well, believe it or not, I envy you because my mother has perfect physical health, but she doesn't even know who I am."
Yeah.
She said, "At least you can still talk to her.
Yeah.
You can still, you know, she's still your mother." And it was interesting because it made me realize that, you know, that I am fortunate in that sense that.
More fortunate would
More,
be
yeah,
not
okay.
having a sick mother.
Yeah.
I think that's one of those little voices where you're telling yourself, it could be a lot worse. Why are you feeling so
Well,
bad
that's
about this?"
true.
You
That's
know?
true.
And other people are happily recruited into that role
Well,
of
that's
telling you
true.
that
That's
sometimes.
true. Yeah, that's
But
true.
you've lost your father and your
Yeah.
mother's in a worrisome condition.
She is, and she is. And again, it's a condition that she won't take care of herself.
Oh my.
You know, she knows what she needs to do to improve her health, and she
doesn't
do it. And it's unusual for me to see that because that is not her personality.
Yeah.
So
she's given up too.
She's
in a
kind of
way.
given up. She's kind of given up.
Huh.
Yeah. And I think that's the part that's really hard for me to watch.
Yeah.
So, you know, it's. So I worry about her. Yeah.
We're getting toward the end.
Okay.
How has it been for you?
It's been difficult, but
Yeah.
not horrible.
Well, that's good. You can bear it.
Yeah.
It is difficult therapy. It's really difficult getting
Yeah.
into this
Yeah.
painful stuff.
I remember a friend of mine told me her therapist told her it's like surgery without anesthesia.
Yeah.
And that when he was telling her to be ready to.
There's comfort in it too, but it's painful.
Yes. Well, I think there's comfort always in talking to
Yeah.
someone.
Is there anything you want to ask me or?
I guess my question would be whether you think that I am ready for that kind of therapy, or if I'm too kind of unwilling to take those steps.
Oh, it's a good question because you can feel in yourself both sides of that very strongly, right?
Right.
I think you can do it, and I think it would be greatly worth it to you to do it. I think you should be very careful to interview several therapists. And
I did that before, actually.
Be sure you get a person that you really trust
Right.
and that you really trust to hang in with you,
Yeah.
because that will tilt the balance
Yeah.
toward your being able to fight the part of you that wants to just say, oh, the hell with this.
Right.
I'm out of here.
Right.
This isn't working like everything else isn't working.
Right.
And
Right.
that is pretty predictable that could come up. But it will be painful, but I think you'll find it healing. And I think you'll be able to make changes, but it's not going to be real fast.
Right.
Does that
Right.
feel right to you?
Yeah, yeah. I would like it to be overnight.
Of
but,
course.
But I'm sure everybody does. But,
Yeah.
but
Okay, well
All
then I
right.
guess we'll stop there.
okay. All right then.
It was a pleasure
It
meeting
was
you.
so nice meeting you. Thank you so much.
You're very welcome.
Before we watch Judith Beck demonstrate cognitive therapy, I have a few questions that I'd like to ask her about this approach. Welcome, Judy.
Thank you.
So, what is cognitive therapy?
Well, cognitive therapy is a psychotherapy that was developed by my father, Dr. Aaron Beck, in the 1960s. And it's a psychotherapy that aims to be as short-term as possible. It's very educative. We put a big premium on relapse prevention. And about half of what we do in cognitive therapy is to help people solve their problems that they're having today. And about the other half of what we do is teaching them certain skills, particularly cognitive and behavioral skills, that they need to get better.
So, what is the basis of the foundation for this approach? You mentioned education. Is it like a learning theory?
Well, it is based on an information processing theory. So the theory behind cognitive therapy is that the way that people perceive their experience is more closely connected to their reaction, their emotional, behavioral, and physiological reaction than the situation itself. So one important part of cognitive therapy is identifying the thoughts that people have that then lead to a distressing or a dysfunctional reaction, and helping them to evaluate their thinking and change it so that it more closely resembles reality.
So the focus really is on thoughts and thinking. Is that how it's unique?
It's unique in that the theory underlying cognitive therapy really does put this premium on helping people change their thinking. The whole reason, though, that we want to help people change their thinking is so that they can have a lasting impact on their emotional state, on their mood, on their behavior, so they can act more adaptively and reach their goals. And particularly important with anxiety patients is that it'll have a lasting effect on their physiology.
So can you go through the steps and stages of your approach? And I believe you start with wanting to find a diagnosis.
Right. First, we do a very thorough evaluation, because the cognitive therapy treatment for one axis 2 disorder, such as depression, may be quite different from the treatment of another axis. Did I say axis 2?
You said axis 2. I think you meant 1.
I did. I meant axis 1. Sorry. The treatment for an axis 1 disorder, such as depression, has some similarities, but it is also quite different in other ways from another axis 1 disorder, such as obsessive compulsive disorder or eating disorders or substance abuse. At the beginning of treatment, we are generally socializing people to the cognitive model. So we're having them start to view their experience and their emotions through this lens of how their perceptions are influencing how they feel. We tend at the beginning of treatment to focus on the current problems people are having today, and kind of in a fairly methodical way helping them solve their problems. And oftentimes what gets in the way of solving problems are certain dysfunctional or inaccurate thinking. Toward the middle of therapy, we tend to put more of an emphasis on people's underlying beliefs, their basic understandings about themselves, their worlds, and other people. And then toward the end of treatment, we are really working toward termination, consolidating the skills patients have learned, and doing relapse prevention, so that when similar problems might come up in the future, patients know exactly what they need to do to solve them.
Now, you've mentioned relapse prevention twice. Can you talk a little bit more about that, what that means in your model?
Sure. We are not only trying to help people get well, but also stay well. And so we're actually teaching them to become their own therapists. When we use certain techniques with patients, such as identifying and modifying their thinking, we're not only doing that with patients, we're teaching them how to do it themselves.
That's where the learning and education comes in.
That's right. And, you know, and we tell patients it's not enough to just come and talk for 45 or 50 minutes a week, but they're going to learn things in every session that they're then going to practice at home. And that's how we find that people get better, by making small changes in their thinking and in their behavior every day.
So that would be a big strategy and technique. Are there other ones?
Oh, there's lots. In fact, in cognitive therapy, we borrow techniques from every modality. So we obviously use a lot of cognitive and behavioral techniques, a lot of problem-solving techniques. We use biological techniques because many of our patients are on medication to begin with, or want to start on medication. Although we try to work without medication if it's indicated and if patients want to do that. We also use environmental techniques. Sometimes coming to see us once a week is only a drop in the bucket, for example, if the patient is going home and being abused every day, or if the patient is in such a deleterious work environment that it just is dragging them down every single day. We also might use Gestalt kinds of techniques or experiential kinds of techniques, especially when patients say, you know, I get what you're saying intellectually, but in my gut, I just don't believe it. Then we know we have to use more imagery techniques, psychodrama, things like that. We also, if I can mention one more, well, we use a lot of supportive techniques, a lot of good counseling skills, and we also use what look like psychodynamic type techniques, especially in developing the therapeutic relationship with Axis II patients, because we often find that they bring certain beliefs about themselves and other people to the treatment session, and sometimes have negative thoughts about us therapists. And so we use the same kinds of techniques of identifying the automatic thoughts they have about the therapist or about the process of therapy, and then help them evaluate and respond to those ideas.
So the cognitive therapy, that's the lens that you look through, and then the way that you bring about change incorporates a wide variety of techniques and strategies.
Right. So it's important to understand that the therapy is not defined by certain techniques, it's defined by our understanding of patients. Not only that their thinking in certain situations leads to their emotional reaction, but we also want to take a look at what those underlying beliefs are. So patients oftentimes will have some very negative ideas about themselves, their worlds, and other people. And not with all patients, but especially with Axis II patients, it's very important to find out what happened to them historically, what happened to them as children that then led to the development of these very negative beliefs. And then we also want to find out, well, how have they coped with these negative beliefs all of their lives? What kind of behavioral strategies, coping strategies have they developed? What are some of their rules for living that may or may not have been helpful to them as children, but certainly are not universally helpful to them as adults?
So this is really a broad approach that deals with people in whatever way that they need to be dealt with, it sounds like.
That's
right.
right.
You really tailor this approach.
We do. We have to tailor it to the individual. So we take into consideration the patient's gender, age, developmental level. We get very good grounding in their history. So we want to find out all about their psychiatric history, their medical history, educational, social, family, and so forth.
Now, there's a strong research base for your approach as well.
That's right. There are probably between 400 and 500 outcome trials that show that cognitive therapy is effective for a whole range of disorders.
What are some of them?
Well, all of the major psychiatric disorders. Now, when we have someone with severe mental illness, such as bipolar disorder or schizophrenia, we often insist that the patients be on medication as well. Although the more skilled you are as a therapist, the less likely you might be to absolutely need medication with patients. But with the severely mentally ill, of course, it's indicated. It's also very useful, and outcome trials have supported this, in the treatment of medical disorders with psychological components. So things like insomnia, overweight and obesity, fibromyalgia, chronic pain, migraine headaches, and a whole host of problems. And then for a lot of the psychological difficulties too, marital problems, couples problems, family problems,
Wow.
work problems.
So it seems it really works across the board.
That's what the research has shown us.
Yeah. Now, in a moment, you're going to be working with an actual client. What are you going to be looking for in this client? I mean, what's going to be important for you?
Well, the first thing I'm going to need to do is to find out what the patient's symptoms are. And so I will have had him or her fill out a Beck Depression inventory and an anxiety inventory, and we'll also get a subjective description from the patient of how he or she is feeling, especially compared to the past. So I will want to do that. The second thing that I'm going to want to do is to find out what's really important to the patient to discuss. So I will ask, what problem or problems do you want my help in solving today? And by having a very specific agenda, then we make sure to be able to cover what it is that's most important to the patient, which, by the way, may or may not be the first item that the patient comes up with. Sometimes when patients set the agenda, they'll say, oh, I want to talk about the problem at work because they've just come from work and they're very distressed by that. But instead of immediately launching into discussing that problem, I'll also ask the patient, okay, so there's a problem with work. Is there anything else you want to make sure and talk about today? So as you can see, cognitive therapy is a very collaborative process. We make decisions together on topics such as what to spend time on in the session, how to approach the problems, what kinds of follow-up things the patient might do at home.
You may have answered this question, but I'd like to, just to make it stand out a little bit more. So are you going to pay more attention to the symptoms, their story, you know, the narrative they have, their thoughts, their feelings, their behavior?
Well, I'm going to need to pay attention to all of them. So as they're discussing a problem, let's say it's a work problem.
Right.
I'm going to be finding out many different things. So I'm going to find out what is the specific problem, when is it the worst, how long has it been going on, what have they already tried to do to solve this, and so forth. So I'll collect a lot of data about the problem.
So that's some history about the problem.
That's right.
Okay.
And then I'll find out, when was the problem the worst this week, or when did the patient feel the worst about the problem this week? What was the emotions that the patient experienced? When he or she experienced those emotions, what was going through his mind or her mind? What were the patient's automatic thoughts?
Oh, okay, so that's when the thoughts come in.
Right. And then I'll want to find out, well, what did the patient do?
Okay.
And if it's an anxiety patient, especially where there's some physiological reaction. So I'll want to flesh out the cognitive model in that way. And then I'll think to myself, and I'll also collaboratively agree with the patient, where are we going to start working? Are we going to work at the problem situation level and do problem solving? Are we going to work at the automatic thought level and help the patient respond to distressing or distorted thinking? Is the patient so upset that we're going to work at the emotional regulation level and bring the patient's emotion down a little bit, maybe through distraction or speaking more conversationally, and before we get back to the problem? Are we going to work at the behavioral level? Maybe the patient would benefit from some skills training. Or maybe the patient is so anxious that we will do some relaxation training to get his physiology calmed down. So I'm going to be collecting a lot of data about the problem and then collaboratively with the patient decide where to start working. We might work at one level, we might work at all of those levels. If it's more toward the middle of treatment, we might be working more at the underlying beliefs that then gave rise to the automatic thoughts.
Okay, so you've got a lot of things that you want to make sure that you do, and depending upon the stage. What do you not want to do? What do you want to be sure to avoid?
Well, I certainly want to avoid anything that would damage the therapeutic alliance. So the therapeutic alliance, I don't care what kind of psychotherapy it is probably the most important element in psychotherapy. Now, it's important and it's necessary to have a good relationship, but it's not sufficient.
Not sufficient, right.
So I want to make sure and be collaborative with the patient. I want to get feedback from the patient. I want to make sure that the patient and I are on the same page. I want to make sure that the patient is understanding what I'm trying to tell him or her. And I especially want to prepare the patient to have a better week. So I not only wanted to help him feel better in the session, but I want to think to myself and out loud with the patient. So what we've just gone over, how can that help you have a better week? What would be important for you to remember? What would be important for you to do? So I want to avoid discussion that ends in the therapy session with no follow-through.
So what will make for a good client for this approach? What does it work best for?
Well, maybe another way to say that are who are easy clients. And the clients who are easy in cognitive therapy are the clients who are easy for any kind of psychotherapy. So the ones who have a lot of internal and external resources whose lives aren't in too much chaos. The ones who are more easily socialized to treatment. So those are the easier patients. We really need to look at research to see which patients might not be as appropriate for cognitive therapy. And research really hasn't shown us that yet. It seems that most of the research shows that cognitive therapy is about as effective as other treatments for the whole variety of disorders.
And a final question is, what will make for a good session? I mean, what will be effective?
Okay, so my definition of a good session is the patient feels better by the end of the session, and the patient has a really good plan to have a better week. So the patient has learned things in session that he's not only probably going to use this week, but hopefully when problems arise a year from now or 5 years from now or 10 years from now, he'll be able to go back to his therapy notes, because we make sure that patients or therapists write down for the patients whatever they want the patient to remember. He'll be able to go back to the therapy notes and make use of the things he's already learned and put them into place with either the same problems or new problems.
Well, we're going to go now and watch you work, and I'm pretty confident that the same excitement that you showed in this interview will carry forth with the clients. Let's watch.
Thanks. Chi-Chi, it's nice to see you again.
Good to see you, too.
Even though I just saw you this morning. But I'm glad we have a second session together.
So am I.
So if this were ongoing treatment that we would be doing, I probably wouldn't have seen you for a week or so.
Right.
And the first thing I would do would be to do a mood check to see how you were feeling, especially compared to other weeks.
Okay.
And I'd find out what was important that happened between last session and this session that I should know about. You'd probably tell me some negative things, and then I'd ask you for positive things as well.
Okay.
And then the next thing we would do would be to to set the agenda. So that's where we'll start, if that's okay with you.
That's fine. That's fine.
So I had one idea in mind of something that might be important to talk about. But is there something in particular? We really covered the procrastination problem this morning, and we have a plan for dealing with that.
Right.
Is there anything else you want to make sure and talk about?
I did want to talk a little bit more about work, even though that is a similar problem.
Okay.
I do feel that my problems with procrastination and poor time management contribute to an unnecessarily high anxiety level at work. And I think that it's having a negative effect on my job performance, and I worry that, you know, every time, you know,
something happens, I immediately start this panicked thought of, oh my God, I'm going to lose my job.
Yeah.
So I think that's one thing I did want to talk a little bit more about. And then aside from that, I mean, whatever you think is.
Let me tell you my idea, and
Okay.
feel free to say, yes, that sounds good,
Okay.
or no, that sounds terrible, I don't want to talk
Okay.
about it. During the evaluation, there was one time when you got very teary, and that was when you started to think about a relationship, a 6-year relationship you had that ended about 15 years ago.
Right.
And it sounds as if you got help at the time, but that there were certain feelings that were so painful at the time that you didn't talk a whole lot about
Right.
that relationship.
Right.
And I couldn't tell to what degree that's still distressing you, that breakup.
It goes back and forth. If I don't focus on it and don't think about it, then it's fine. And I think as time has gone on and the fact that I'm currently in a good relationship, I think that's made a big difference.
Do you feel that when it goes back and forth, especially the back part, I guess, that your reaction is stronger than one might expect after this
Yes,
period
I
of
do.
time?
I do think so. I don't know why.
Well, that's why I was wondering whether it might be worth talking about that. So maybe you wouldn't have to have so much back and forth about it.
I'm not ready to do that yet.
Yeah. Make sense. So why don't we agree not to talk about it? But you know what? The other thing I was thinking that might be helpful is if we talked about your fears of talking about it.
Okay.
Is it all right if we spend maybe a couple minutes on
Sure.
that, and then you can decide whether you want to continue talking about it or not?
Sure.
So if you were to talk about it, what's the worst thing you're afraid would happen?
That I would be overwhelmed. And then I'd be stuck there.
I see.
I wouldn't be able to move past it.
And what does being stuck there mean?
Stuck in just this feeling of that I haven't been able to move on from my past,
Yeah.
that I haven't forgiven myself
Oh. Okay.
for that mistake.
Yeah. So there are a couple parts to this. If you were to talk about it, you would get very emotional,
Yes.
and you're a little afraid that that emotion would just stick with you. And
Yeah, and I also think that when I talk about anything that makes me emotional or teary, it's very hard for me to get past my initial feeling and talk about it in a rational way.
right.
I find that happens a lot, and that has been an issue in relationships. I find it very difficult to talk to have a really serious conversation with somebody that I'm in a relationship with, even a friendship with, without getting carried away by emotion, whether it's anger or just getting teary or whatever. It's very hard for me to do that.
Yeah.
It's very hard for me to talk about how I feel or what I want in a way that's just calm and rational.
Yeah.
I don't know why, but
Well, it's hard for a lot of people.
okay.
It sounds like it's not so much of an issue right now because Mike is away
Right,
for a while.
right, that kind of.
But when he comes back, might it be an issue again?
It's an, yes, I think it is. I think it's an issue because we have very different styles of communicating, and I definitely think that there are things that we do need to talk about that that neither one of us has been able to really do. I mean, I don't know if is it a problem? Somehow we've managed to, I mean, we've been together 9 years, I think. And So obviously we must be able to communicate on
Yeah.
some level. And
Well, I was wondering whether you might want to just talk about this fear you have of experiencing negative emotion. We don't need to talk about the breakup.
Okay.
In fact, it might be more helpful to talk about it in the future for when Mike comes and there are important
Right.
things to talk to him
Right,
about.
right. I think that my fear is that I'm going to get so carried away by, and it's not just a fear, it does happen, that I get so carried away by my emotional reaction
Yeah.
that I don't really end up saying what I want to say.
Yeah.
And then I get upset with the other person for not somehow magically understanding it without me having to say
Yes.
it. And I know that that's a problem. I know it's a problem. I know it's happened over and over. But I don't see a way out of it.
I see a way out of it.
Oh,
I see some things that I think could help.
okay.
But I don't want to, if you want to talk about the anxiety at work.
No, this is interesting.
This feels like a little bit more central.
This is interesting,
to,
yeah. And it's, yeah.
And if we have time, we can try to save a couple minutes at the
Okay.
end for the anxiety
Okay.
at work.
Okay.
So we can either talk about something that you have tried to bring up in the past, or we could talk about something that you could imagine you will want to bring up in the future.
Right.
Which do you think would be more helpful?
Let me think for a minute. I guess we could talk about we could talk about something that's ongoing, I guess.
Oh, that's
that-
even better.
Yeah.
So tell me about that.
Well, occasionally Mike will talk about our future together, and he'll say that he wants us to get married or live together or any of those things. And then we'll talk about it, and it seems to be a good conversation. But then the next time that I bring it up or want to say something about it, it's like we never had that previous conversation. It's gone. And so it seems like it's almost like he's responding to some sentimental feeling or some romantic feeling, and he talks about this stuff, but then when I want to talk about it and want to really pin him down, it's like it never happened.
What does he say?
He just says, we'll talk about that later. And so that's one thing. I also feel like I haven't really conveyed to him what some of my concerns are with. I feel like he'll talk about things that he wants to see happen and is completely ignoring what I'm saying. One of the big issues that we had in the past, I think it's not going to be an issue now just because of biology, is he would sometimes say that he wanted to have children and he wanted us to have children. And he would, he's a very methodical, logical person, and he would sit there with this very long methodical list and go through it, and I would be responding very emotionally, trying to get him to see my point of view, and I would feel like he just did not hear a word I was saying. That he would just keep on with his list and just talking right over me while I was just screaming at him. And so I still feel like that these issues are unresolved, and I still sometimes wonder, like, does he still think that we're going to have a child? And if so, why does he think that? And every once in a while he'll say something that indicates that he does, and I go, but again, when I try to pin him down, he just skitters away. So it feels like there's these kind of big, important issues out there that couples need to figure out that we haven't. And so I think that's frustrating.
Can you wait till the next time you see him in person to have a conversation with him about these things?
Yes, yeah.
And you think that would be better than on the phone?
I think so.
The phone is awful hard because you can't get the nonverbal feedback.
No, you really can't.
That
You really
way.
can't.
Yeah.
And it's.
Yeah.
And we do the video conferencing, but that's not the
Not
same
exactly
either.
the same,
It's not
yeah.
quite the same.
And when do you see him again?
In 2 weeks.
Oh, he's coming very soon.
Yeah.
Oh, okay. So
Yeah.
this may be apropos to that time.
Yeah, yeah.
So what would you like to say to him?
I would like to say, I have tried to tell you that this idea of yours it's not going to happen, and I've tried to convey that to you, and you keep coming back at me with this, methodical list of reasons why it should happen, why it can happen, and you've never heard my point of view. Or if you have, you've pretended that you didn't because it doesn't coincide with your point of view, and because if we can't agree on this, then we probably can't be together. And I actually have told him that. And he just got very upset and was like, well, that's an extreme reaction. But I think he thinks that he can win me over by using logic and,
Persistence.
Persistence, yes.
Yeah. Yeah.
And he just is not getting
Yeah.
it.
Now, I wonder whether there might be another way to approach him. If he were to say something like, Mike, I have something to talk to you about that really makes me upset, but I'm going to try to talk about it in a way so that I don't get so upset. Is it all right if is this an okay time for me to talk to you about this? So you give him a little bit of the control over the time.
Right.
And then he'll probably say, well, what's it about? And you'll say
Right.
it's about having children. And then he might say, well, I don't want to talk about it now.
Yeah, that's probably what he'll
And
say.
you might say, well, can we
Right.
let's set a time then before you go back, because
Right.
we only have. how
We'll
much
only
time
have a
together?
few days. We'll
We'll
have
only
about a week.
A week together. So you might want to bring this up, fairly soon to the
Yeah.
beginning.
Yeah.
So maybe you could set a time if he doesn't want to talk about it right then. And it might be a good idea to do this when you're out at Starbucks or someplace having coffee
Right.
or something.
Right, right.
And then you might, the way that you presented it before is certainly a reasonable way to present it, except that you come across as a little bit angry and critical of
Yeah,
him.
yeah.
So just another way of approaching him might be to say, I'm really confused. Because it's obvious to me that you've wanted a kid, or you've had positive feelings about having a kid for a number of years, and I haven't wanted to. And I thought that I had made that really clear, but I'm confused as to what's in your mind and whether that's still
Right.
something that you think is going to happen. And then, how do you think he would react if you said it that way?
I think he would probably say, what would he say? He would say, well, what are your reasons for that you think that you don't want to have a child? Or that you don't think you can have a
See,
child?
Mike, I'm a little confused because I feel like I've gone through all of the reasons before, and I feel like you think, gee, if Chi-Chi can't make a case for this, then we'll have a child.
Right,
And,
right.
and I have to tell you, just in my heart of hearts, I love you, Mike, and I want to stay with you, Mike, but I just don't think it's a good idea for us to have kids. And you're just not going to win me over.
Right.
And then what do you say to that?
What would he say? I don't know. He would probably say, he would probably say, well, let me hear all of the objections and I will provide a solution for each of those objections. That's his way.
Yeah.
If you say, I don't want something, I don't like something, his way is to say, well, give me all of your objections and I will come up with a solution for each one.
And out of role play, Chi-Chi, do you feel like you've already done that?
Yes.
And there's just no way he's going to...
No.
And so then I think you have to say, Mike, just any amount of logic
Right.
isn't going to change my mind on this.
Right.
I'm really sorry. I mean, I
Yeah.
wish I could go along with you. I can
Right.
see that this is really important to you, and I like to make you happy, and I
Right.
wish I could do this for you. But
That would be a good way to
But I
phrase
really
it.
can't.
Yeah, I think that would be a more constructive way to phrase it than what I have been doing, which is to kind of, you're not listening to me. But
And what do you think he would say?
I think then he would probably hear it, and he would I think he would hear that, and he would understand that to some level. I don't know what he would do after that. I don't know. Part of my frustration with it is that I think that he has been in long-term relationships in the past. He had 2 long-term relationships before me. My feeling is that people who want to have children do that. They know that, and they do that pretty early in their life. So why didn't that happen with those? Well, in fact, I know in one case, it was the woman who wanted to get married and have children, and he didn't.
And he didn't.
So part of me wonders how much he really does want this.
Yeah.
Because I think people who do want children know it early, and they plan their lives that way.
That may be, or for any reason, but in any case,
Yeah.
I'm not sure how relevant that is
Okay.
if this is something that's so strong inside of you.
Okay.
Now, are you fearful that he may want to break up with you?
I am.
And would you tell him that? Mike, I'm really afraid you're now going to want to break up with me. Then what would he say?
I don't know.
So we ought to think about whether or not you even want to have this conversation then, because there is a risk to the conversation.
There's a very big risk.
Yeah.
There's a very big risk. I don't think he would,
But he might need to think about it.
but he might need to think about it. Yeah. I mean, I'm pretty sure he wouldn't, but you never know.
You don't know. So maybe we should talk about whether you want to have this conversation or not.
I think we have to have it because we've had all these years, together. And are we going to go along another, 8, 9 years without this being resolved?
Right. So you think you are better off just knowing one way or the other?
Yeah, I do. And I think that, and I think he needs to know. I think he needs to know because if it does mean that much to him, then he does need to,
Yeah.
Find someone that will do that.
He should actually have a rent-a-child for a little while, I think.
Before he makes that decision.
Yeah, but anyway, it's not under your control.
That part of it is out of my control.
I think we need to talk about if you have this conversation and if he decides to move on, what can you do to move on? Better, perhaps, than you were able to 15 years ago.
I don't know. That's going to be really tough.
Yeah.
It's going to be really tough.
Are you in the same position in life as you were 15 years ago?
No, I think I'm in a much better position in life.
What's better now?
I'm more financially stable. I'm more, I've learned to be more independent. I've learned to be more self-sufficient. So I think I'm better in that sense.
Yeah.
Just older and wiser.
Yeah.
I know that it wouldn't kill me,
Yeah.
but
Are you afraid of that negative emotion you'll feel if it happens?
yeah, I think it's going to be pretty bad.
Yeah. Do you have a picture in your mind of what it might look like if it's really bad?
I think it's going to be pretty devastating.
Do you see yourself someplace?
It's hard to even picture it. It's at that point, I don't know. I don't know if it would be. It wouldn't. Like I said, it wouldn't kill me, but it would be. It would be very tough. It would be very tough.
When would it be the toughest?
When? Having to go through the day, go to work, pretend that everything's normal.
Yeah. And would there be anyone at work you could confide in?
There are a couple people I could confide in.
That make it better
A
or
couple
worse?
of colleagues. I think that would help. I think that would help at least, at least to sort of say, I might be a little strained. I mean, maybe work would be
a good place to take my mind off it.
Distraction.
A
yeah.
distraction. It might be a good. It might be good that way. I have. You know, I certainly have friends that I could, you know, get to distract me, as it
Yeah.
were.
And to give you some support.
Yes, emotional support.
really
Just
important.
yeah. So I think in that sense, I would have more of a support network
Yeah.
than I did before. I think I don't know. I always say that if anything happens with me and Mike, that I'll never be in another relationship again.
Mm-hmm.
So maybe that would be the way that I would handle it.
Well, what do you think about that? Do you think that's true, that you'd never be in another relationship again?
It would be really hard. It would be
Mm.
really hard to start over.
Yeah. It would be hard. There's no question
It would,
about it.
yeah. I don't know if it would be worth it. You know.
Well, it wouldn't be worth it if you never found somebody.
Well,
Probably would be worth it if you did find somebody.
yeah. Well, it seems like I would. It seems like it would be a lot of effort for a slim to little payoff. So,
Well, why do you think the payoff would be slim?
I think it's hard to find a good relationship, and I think it takes a lot of work when you're single to find somebody good, and especially as you get older. And I wouldn't want to go through all this again.
You know, I mean, getting more intimate, getting closer, and then getting hurt again.
Right, right.
Yeah. No,
Right.
of course you wouldn't want to.
Yeah, yeah.
But do you think, especially if you perhaps were seeing a therapist, that would make it easier for you to do
Yes,
that?
I think so.
Might
yeah.
that be something you would plan to do?
Probably, yeah. Yeah, I would probably have to. I would probably have to have one lined up just in case. You know, just in
Not a
case that.
bad idea.
Yeah, yeah, yeah.
And you'd have your cats.
Of course.
Your cats are important
Of
to
course,
you.
they're very, very important to me.
Yeah.
And
You might have your writing. Who knows? Maybe you do some.
I might have all kinds of things that could be a good substitute.
How long do you think it would be before you kind of had your sense of equilibrium back?
Well, even in the past when I've had really bad breakups, I think I always spent, it's hard for me to remember, but it seems to me looking back that I always spent a short time of feeling just absolutely terrible and just wanting to die, and then but that feeling passed pretty quickly.
Yeah.
And then you know, you have to move on. I don't know. It's hard to say. It's hard to say.
Maybe you find a Mike-like person who either has kids or they're grown or doesn't want kids.
Right.
Or whatever.
It's possible. Yes. Yeah. Or he could decide that, you know,
He wants to stay.
that he wants to stay.
Yeah. Yeah.
Any of those things are possible. But I feel like, see, I've had very bad judgment about men always. So I feel like even just being able to find Mike was such a stroke of luck for me that I don't see that repeating again.
Oh, that's interesting. Well, what was it that drew you to Mike?
We started off as friends, and he was completely different from anyone else I'd ever been with. And in fact, I remember saying that to a friend of mine, and she said, her response was, "I like him already."
Oh, nice. So she recognized how important that was. So something changed in you. You saw something different in him.
Yeah. Yeah.
And apparently you must had some kind of equation like this, even without your friend telling you. But this new thing is good.
Yeah.
But
Yeah.
Are you afraid you'll just lose that judgment?
Well, I don't know. I mean,
how come I never had it be, I don't know what changed to make it. I'm not sure what that.
Well, it sounds like to me that Mike is different from the other guys. And so in what ways is he different?
He's very, being in a relationship with him is very, it's very calm, it's soothing, it's, I mean, that sounds boring, but it's not.
No, I understand.
He's reliable, he's predictable in some
Yeah.
ways, he's serious, he's a very, he's very caring in a he's actively caring. Like I said, he's the type that if you have a problem, he will figure out some way to fix it, whatever it is.
Are you thinking you would not pick this up about another guy?
I don't know.
You'd not be able to tell whether another guy was calm, soothing, reliable, predictable, actively caring?
I don't know. I never did before. All my past relationships tended to be pretty chaotic.
Yeah.
Guys that were kind of wild and cheated on me and were, drank too much and couldn't hold down a job. All those.
Are you giving yourself enough credit here, Chi-Chi? You'd think you wouldn't tell the difference between calm, soothing, reliable, predictable, and wild, cheating type drinks too much?
I think I would tell the.
I think you would tell the difference too.
But I'm afraid that somehow whatever was working at that point.
Well, do you have a safety net? I mean, someone you could bounce this guy off of?
Probably. Yeah. Oh yeah. Sure.
Like who?
Friends.
Friends. Or if you're seeing a therapist.
Or a therapist. Yeah.
Yeah. So you wouldn't have to 100% rely on yourself.
Right.
No, my guess is you've probably developed this gut sense now.
Maybe. It took me a long time, though.
It did take you a long time. But sometimes once you get that learning, it just takes hold.
It's true. I mean, sometimes I think, sometimes I think about Mike and I think, God, I could never go back to those bad guys again after this. I would never tolerate it,
Chi-Chi, we've just talked about so many important things.
I know.
No, I just think we should probably get some of them down in writing.
Okay, that'd
Do you want to
be great.
write or you want me to?
Whatever you think is better.
Doesn't matter.
Okay.
Or we could both do it if you want. Doesn't
Okay,
matter.
okay.
So let's see. Do you want to just start or do you want me to ask you a question to start?
If you can start.
Okay. So we talked about having a discussion with Mike. And so do you want to write down something about what that discussion should look like?
Yeah, that would help me, I think. Yeah.
What should we say?
I'm trying to remember how we had phrased it. Setting up a time to talk.
Yeah.
Because almost guaranteed he'll say, this is not a good time.
Yeah.
So making sure that we set aside a time to talk. I would probably have to let him know that it won't be, a long, drawn-out period of time.
Oh, that's very good. So I want something to talk. Maybe we could talk for about 20 minutes about it or
Right,
something
right.
like
That
that.
it won't be a
that's
long,
great.
drawn-out.
Now, I don't know if this helps, but I'd use the word confused. I'm confused, Mike.
I think that would be a good way to phrase it.
Confused.
Because then it's not like I'm saying that I'm angry or I'm hurt or just confused.
And another thing we talked about was saying, I'm so sorry that we want two different things
Right.
here.
Right.
And then, I would give it to you if I could.
And I would. I mean,
Yeah. And we talked about if he insists of saying, again, I'm confused, we've already been through this, this isn't
Right,
going to work.
right.
I imagine if he keeps on insisting that you may have to go along with him and say, okay, I'm willing to do this one last time.
right.
And then at the end, I have to tell you what my conclusion is.
Yeah.
Insists, confused, we've been through this. But compromise if you need to. One last time.
Right.
Is there anything else that you want to have in this conversation with Mike?
That I think that's,
you know, that I do want to stay with him,
Absolutely.
but that this is just not something that I can do.
Yeah.
If there were any way to do it, I would, but.
Yeah. Okay.
Now, I hope I can do all this without.
Well, then, if you think you can't, then I think you have to say to him, I'm going to try to do this without crying. I'm going to try my hardest. I know it's really important to you that I not cry. If he's like most men, he's
Right.
going to say, but I might, but I'm going to try to, I
Right.
want you to know that I'm going to try to control it as much as I
Right.
can.
Right.
Okay. I think most women would find it extremely difficult to have this conversation without crying, so you're in good company, Chi-Chi, if you cry. Then the next thing we talked about is if he breaks up, if he
Right.
decides to break up with you. So if we break up, and what do you think would be important for you to remember?
That I have a support system, that I can get through it.
Yeah.
That I'll have to slash his tires on his car. No!
You could just key it. Key. Get through it. Another thing we talked about was that the intense emotion is short term.
Right. Right. As I recall, people who were there with me might remember it differently.
Well, usually it
but
kind of
that's-
comes and goes, but most of us can't maintain emotional
No.
intensity for
Right.
a long period of time. We said that work could be a distraction.
Friends, therapy.
Yep. Friends, therapy. And we also talked, if we break up, that you'd have a choice then, that you might at some point find somebody else.
Yeah. I can't really think about that part of it.
So maybe we should say something like, could talk to a therapist
Yeah.
about a new relationship. Doesn't mean that you're obligated to.
Right.
But we also talked about how your judgment is much different from how it used to be.
I hope so.
I better put judgment maybe
Maybe better than it used to be.
better. I don't think you had a role model like Mike before to compare guys to, or did you? I don't know.
My father is somewhat similar, was somewhat similar.
Although usually you don't want to compare our
I
relationships
know.
to dads.
Yeah, I know. That sounds creepy, right? But
No, if it works, it works. That's fine. That's fine. But it's a natural thing that, not to gravitate toward
right,
initially.
right.
So judgment may be better and can get, I'm going to say, advice from friends,
Therapist.
therapists.
Yeah.
That's good.
Yeah. So.
We also, one of the things we started to talk about a little bit is too that you could enrich your life in other ways.
Yes, that's yeah.
In fact, the other ways that we were talked about this morning.
That we already talked about. Right.
We talked about this morning.
And I think that makes a big difference also,
Yeah.
because those would be distractions, but healthy distractions as opposed to, some of the others.
Did you want to talk about this anymore? Or we have a couple minutes left to talk about work. If you'd
Whatever you
rather.
think is there.
I don't know.
if
Do you
there's-
have your sense? What's your gut say about?
I feel like this has been a very good, I think we've handled this one for now in a good way.
Maybe
in
we
a good
could
way.
talk about work and apply some of the things that we talked about here to work.
Right.
Okay. So a typical situation is you're at work, and then what makes you have the thought, what if I lose my job?
If I feel like there's something coming up, something I have to have done that I'm behind on, and I'm scrambling to get it done, and my boss is asking me when I think I'm going to have it done, and I always do get it finished, but in doing so, I've created all this anxiety for myself, and I feel like I'm in a panic state, and I feel like I'm forgetting some important piece of it.
Yeah.
So I seem like I just caused myself all this unnecessary panic and worry, and we have had layoffs at work.
So, you know, everyone is just kind of hanging on.
Yeah.
And
Okay, so the first thing I want to point out to you is the reason that you feel anxious is because of what's going through your mind. You could have the same situation at work, behind, scrambling, bosses asking me when you're going to get the project done. And if you had the thought, well, he's a little anxious himself, but I've
a
always
she,
gotten,
but-
or she, I'm sorry.
That's all right.
I've always gotten my projects done in
Right.
the past. You know, even if I screw up this one, so it's 1 out of, 50, then I haven't gotten done, I'll probably be okay. If you had those thoughts, then what would your anxiety be like?
it would be a lot less.
Be a lot less.
yeah.
So our emotions are influenced by what we think, by our perception of the situation. And when we're anxious, sometimes our thinking is realistic, and sometimes it's not.
Okay.
So one of the questions, I'm going to teach you 2 sets of questions. One set of questions has to do with just looking for the validity of your thoughts. So what's the evidence that if you don't meet a deadline, that you would lose your job? Is there some evidence that your boss said things before?
Not so much about that, but no, I mean, let me think. My boss, I have 2 bosses, and the big boss, I guess. I know it's frustrating to her that she's an extremely organized person,
Right.
very orderly, very organized, very that way. And I know it's frustrating to her that I'm not.
Right.
There's someone else in the office that's the same way, and I know she feels that way about both of us.
Yeah.
And, you know, she wants things done a certain way, which I understand. But I always feel like when she expresses her frustration with me about those things, she doesn't do it she doesn't get angry, she doesn't yell or scream. She presents it in a way that she wants me to be better, and she wants
she's not happy about it.
she's not happy about it.
Yeah. Now, would the unhappiness go to the extreme of firing you, do you think?
I think if it kept up, I think it would be, I would have to screw up pretty badly
Yeah.
to get fired.
And when you're at work and you're behind and you're scrambling, would this be a major screw up?
No, I mean, as long as I get it done and get it done properly and on by the deadline, no.
And well, what if it wasn't by the deadline?
Then that would be a pretty big screw up.
And she would fire you then?
No, I would probably get a warning or be put on probation or something
Right.
like that.
Right. In which case, you could use the skills we talked about this morning to get yourself to beat the deadlines better.
Yes, exactly.
You know what we
exactly.
didn't talk about it. In fact, what just as an aside, a problem-solving thing might be to set yourself earlier deadlines than your actual deadlines.
Yeah.
So
yeah.
that may help.
Okay.
Okay. So you screw up badly once. Chances are she wouldn't fire you, but she wouldn't be happy about it. Is there any evidence on the other side that you could screw up and not get fired?
Yeah, I think.
Have other people screwed up? Have you screwed up and not gotten fired?
I mean, yeah, definitely there are. This other woman in the office that I was talking about, she was telling me that she was worried about her evaluation that's coming up because even though she does a really good job, she can never get to work on time. She's always like an hour late.
Yeah.
And she said, you know, our boss, she said she keeps bringing this up every time we have an evaluation, and you know, she keeps saying, can you please just get here?
But she's never
on
gotten
time."
fired for it.
But she's never gotten fired for it.
Yeah.
You know,
So maybe there's a little more leeway.
there might be a little more
it
than
feels,
I think. Yeah.
The other thing to remember, I think, is that you're a known quantity to your boss.
Right.
and anyone that she would have to hire would not be a known quantity unless it's somebody
That she knows.
she knows, or
Right, right.
raising within the
Right.
organization. And if she
Right.
likes things neat and orderly, she might not like starting over with somebody.
With somebody new. Well, that's true.
Okay, so
That's
the
true.
first question when you're making a negative prediction like that is, what's the evidence that this thought is true? And is there any evidence on the other side that maybe it's not true?
Right.
Then the second set of questions are what we call the decatastrophizing questions, making things less of a catastrophe. So if the worst happened and you lost your job, how would you cope with that?
I would take all the practical steps of making sure that I got unemployment and my insurance continued and so on.
Yeah.
I've been fired from jobs, so I know.
And you found other jobs.
So I know what to do.
Okay, so that's a known quantity too.
To do quantities, yeah.
So you'd be able to cope. You know the steps. that you
Yeah,
need to
this
take.
economy is a lot tougher.
It is. So
And
it
I'm
might take
older,
longer.
And
Yeah.
and I'm older, so I can't
But-
be quite
but-
that cavalier
But
about
you'd
it.
survive.
Somehow I
in
would.
the probably unlikely chance that,
Right.
that you got
Somehow I
fired.
would.
But so that's the worst, and usually our minds gravitate toward the worst.
Yeah.
What's the best that could happen in this situation?
I could use my set of steps that we worked out here and do such a great job that my boss would be amazed at how much
Yes.
better I was doing.
Either that, or that you'd get a new job that you liked even better.
That would be, yeah,
either one of those would be the best. And what do you think is the most realistic outcome?
probably the first one. I think getting another job would be,
I'm sorry, just the whole most realistic outcome if you're at work, you're behind and you're scrambling.
oh,
What's the most realistic outcome? That you would get it done in time?
that I would get it done on time, and that I would be safe another day, I
You'd be
guess.
safe another day, or another year,
or another month, or
whatever.
whatever. Yeah.
So
Yeah.
when you're feeling really anxious, you want to look for these negative predictions that you're making.
Mm-hmm.
And you want to ask yourself, well, what's the evidence that this negative prediction is likely to come true?
Right.
Is there any evidence on the other side that maybe it's not likely to come true? And then ask yourself, okay, if it did come true, if the worst did happen, how would I cope?
Right.
But that's just the worst outcome. What's the best thing that could happen in this situation? And then what's the most realistic outcome? And I think if you practice this, you may need a little help with a therapist, or you may
Yeah.
be able to do it on your own, then I think you'll find that your anxiety starts to come down.
Right.
And we use similar questions actually with Mike. What's the evidence that he would leave you or not leave you? What's the evidence that you would or wouldn't be able to find somebody else? If
Right.
the worst happened, how would you cope? Or what's the best and the most realistic scenarios?
That's true. I hadn't. Yeah, but yeah.
So these questions work for any
That's
sense
interesting.
of anxiety.
That's really
that you
interesting.
have.
It's yeah.
So what did you think about our second session together?
I thought it was really good. I mean, I feel like I liked the ability to talk about things that are very deeply emotional and upsetting, but in a way that it seems like this way that you have of breaking things down is very, it makes everything seem smaller and much more manageable than it
Yeah,
is.
that's exactly right. That's what we aim for.
Because it feels, I felt like I came in, and the first session also, with, just these enormous things that were just so huge and blocking, and that after talking with you, it's like, well, those are not really big deals. What's the big deal?
Well, they're big
And-
deals unless you have the tools for them.
Right.
Like the
yeah.
rubbing alcohol for the ink on
Right,
fingers, right?
right. It would be a big deal for you to have that stain on your hand all day,
That's
but
right.
now you don't
but once
have
you have the
to.
right tools.
Right.
And so here are just a couple of tools we went over
They
today.
just seem like they're so much more manageable and
good.
small, and not, and also that they're not the center of my life. That that there are other important things going on. That
Would you feel like you have more going for you
Yeah,
in a
that I'm
way.
not such a big loser.
No, of course not. Of course not. Oh, another one of those automatic thoughts.
Right.
What's the evidence for that? There's a lot of evidence against that.
Right.
Chichi, I'm so glad we had the chance
I'm
to
so
talk.
glad also. Thank you so much.
Sure.
Thank you so much.
Well, now that our viewers have had a chance to see each of you work with Chichi, what we've done is Gary and I have picked some clips from the sessions, and would like to have each of you get an opportunity to talk amongst yourselves about the clips and each other's work. So why don't we begin with a segment that we've taken from Dr. Greenberg's session.
And as the tears come up, can we stay with them, right?
Okay.
I mean, what actually happens inside when you feel all this tearfulness? If you were to go to your body,
I feel like it's never going to change, and I'm always going to be this person that does nothing but talk about all these great things.
it's a kind of sense of hopelessness.
Yes.
Then I think you're
Yes.
saying, right? I just feel like nothing will ever change.
Right.
And
Yeah.
then you sort of move away from that, either by getting angry at yourself
Yeah.
or, and as you say, talk about it, but it doesn't help. But
Yeah.
can we try to stay with the hopeless feeling, your hopeless feeling, right? Where do you feel it in your body if you can? Like, what's it feel like even now as you...
It's like almost like a tightness, like through my chest, and I would say all the way down to my stomach, almost like a sick feeling.
Right, so it's all here.
Yeah, it's all
right,
here.
Right. So if you could try and pay attention to that almost, and it may even help to close your eyes and try and describe that first.
It's like a sinking feeling.
Yeah.
It's like you're on like when you're on the top of a hill or a roller coaster and you're going down, that sinking feeling.
Yeah, okay.
Except it's not exhilarating like a roller coaster
So,
is.
but yeah,
But that just, like I'm drowning, like I'm sinking.
stay with that if you can. And can you maybe even talk from that? I'm drowning, I'm sinking. I mean, this is the difficult feeling.
Yeah, I think that's the closest thing I can describe it to, that I'm drowning, that I can see a light, but I can't reach it, and I know that I will never reach it.
But it's like I can see a light, but somehow I feel like I can never reach it.
Right.
Yeah.
It's up there.
But it's,
It's out of reach.
yeah, I can't get to it.
Yeah. And if you just stay with that feeling, right? It's like I can never get to it. Just let words come from that feeling, or let it go wherever it goes, and just follow the feeling that I can't quite get it.
Les, can you tell us a little bit about what you're trying to do here?
Well, I think this is really working with emotion, and the idea is to approach the emotion, attend to it, symbolize it in awareness, and people tend to avoid being in the present with their own experience. So I'm trying to get her to stay with that experience and to really attend to it so that she experiences it in a present sensory manner and then make sense of it by putting it into words. And I sort of believe you have to arrive at a place before you can leave it. So she's moving to a painful sense of hopelessness, but I believe there's more there, and it'll unfold and move forward, because essentially I'm working with symbolizing an awareness, bodily felt experience. And that's what I would see myself as doing.
Mm-hmm. Any other comments that you might have about this, or questions for Les?
Well, this is one of the places where I felt I would work very similarly to you. you're focusing her in on the body. I would probably be thinking in my own mind that she seems to talk about feeling and tears come out of her eyes, but in some ways she's not fully connected with her feeling. It's a very subtle thing, and I would have probably been doing something very similar there, and I noticed that as you pursued it, she went to metaphor, looking for a light, feeling like drowning, and I know there's a lot of research that correlates with people improving in therapy. So that would be an overlap between
And
our
that
approaches.
metaphor seemed to be exactly what her stated problem was, of not being able to finish, not being able to follow through.
Yes.
Yeah.
And I would have done something very differently from my orientation. I didn't see Chi-Chi as having a lot of pathology. I had her fill out certain scales. She doesn't have a diagnosis of depression. She doesn't have a diagnosis of anxiety. She does have a big problem with procrastination, though. And so what I would try to do is to solve the problem as directly as I could, and then see if certain ideas or emotions get in the way of doing that. Mm-hmm. And so I structured the session to have her make a plan of how she could overcome the procrastination, what thoughts would get in the way, how she would address those thoughts. And if that didn't work, then I might have to go deeper and see what kind of ideas she has about herself underneath that we might need to address. But I would stick to a more superficial level at first and see if that solved the problem.
From my perspective, what you're describing there would be analyzing the resistance. If it turns out there's a resistance within her to doing what you and she collaboratively decided she was going to do,
that's right,
then you would move to the deeper.
And I would also move to focusing on emotion if I were dealing with a client who I knew was really avoiding emotion, who was even having trouble identifying what she was thinking, what she was believing, because she was trying to push away the emotion so much. So that's a particular instance where I really would have people focus on their bodies, on their emotions.
But I think the fact that the emotion is emerging and that the tears are there, they send a very strong message that this is an issue of major concern to me. Yes. So that it's really important to go into them and also validate them.
Mm-hmm. Now, in the intake interview, when I met with her, she said that she responded well in therapy where there was more structure, where she was given direction, and she tended to become overwhelmed if too much emotion was evoked. Any comments on that?
Well, I have kind of a way of thinking about that problem. I think that she does need to go into that affect and detoxify it rather than avoid it. Mm-hmm. I would agree with Judy that I didn't see her as having a lot of pathology, but I think she has a subtle kind of problem inhering in her personality. So it's a funny combination of both. She's not that sick, but at the same time, there's this pattern that has characterized her whole life again and again and again and again. And I wouldn't limit it to procrastination because a variant played out in her most intimate relationship when she sabotaged a potential love affair.
And I saw her as having a lot of distress, and I wouldn't call it pathology, and I don't tend to use a sort of framework of pathology, but I think she had a lot of distress and that she was suffering and that she has had significant personality and interpersonal problems in the past, which she struggles with. She copes, but there's a lot there, I think.
And I think I probably put more of the emphasis on the positive. So when I spoke to her, I talked to her about all of the things in her life that she doesn't procrastinate on, and all of the wonderful strengths that she has, and how maybe what she needs, and I don't know that this is accurate, but maybe what she needs is more of a structure in order to reach these goals of things that she's been putting off.
Well, this is just the kind of discussion I was hoping for.
Yeah, absolutely.
We should move on. And did you have a comment?
The various points, she used a lot of strong words from time to time. How do you pick among which strong words that really imply feeling and affect behind it?
Well, I just go for where the affect is. So where the affect is the strongest, those are probably the ideas that are going to be the most important to go after.
What were you thinking, Les?
I mean, I'm not quite sure when you say strong words, we'd have to look at it specifically, but yeah, I mean, I would think facial expression, vocal intonation, and general poignancy, I mean, are the indicators, and then I would focus, because I see them, and particularly we have a measure of what's called focused voice quality, and it's when a person has this kind of eyeballs turned inwards and the voice is in a particular manner with pauses, that's a time to go in.
I think I do it somewhat more intuitively, but with this, on the same principle that I try to feel where the affect is the strongest, and I think a lot of that goes right brain to right brain, and it's not too easy to describe, but yeah, facial affect would be the main.
Right, and I think one of the biggest things is my own gut response, and what I'm feeling is an important barometer or compass for what my responses are.
Why don't we move on to our next clip, and we'll get a chance to see Dr. McWilliams work with Chi-Chi.
Well, let me change the topic a little bit and go to where I felt that you had the most emotion when I watched the original tape of you with John Carlson. And that was around the loss of that relationship. Are you willing to talk about that and what that meant to you? I think that's connected with this instability.
For some reason, it's really hard for me to talk about that one. I can talk about all the rest. I can talk about the one I'm in now. I can talk about all the ones in the past, all my past disasters. But that one, I think the reason that one is so hard for me to talk about is because I really do think that was one where I really did.
Were you sabotaged it?
Yes, where I really just completely ruined it, and I don't think people should. I don't think it's healthy or good to constantly have a regret about something like that. I think you have to be able to move on, and I think I have. It's just that it's
Well, what comes through is not just regret, but shame. That you, at least that's what I'm feeling from you, that you acted in a way that you feel mortified by, in retrospect.
I do. I feel mortified by it because I feel like it was completely in my hands, and it was completely within my grasp to have made that work. And for some reason, I didn't, and I deliberately destroyed it. And
Are you willing to tell me what you did? I think one of the ways to combat shame is to actually say what's so shameful and see if there's another way to think about it. If it's too much, you don't have to go there.
No, it wasn't. It wasn't something I did that I'm ashamed of so much as, well, I guess part of it is. I allowed I feel like I allowed too many outside influences to make a decision for me that was not in my best interest. And I guess what I feel ashamed about is that I did that, is that I was a grown person and I didn't act on my own, in my own best interest. And that's what, when I look back, that's my regret.
Nancy, can you talk about this clip and what you were doing?
Well, first of all, I was feeling a tension. This was one of the times where I felt the fact that she was on camera and a lot of people would watch this put me in almost an ethical bind. I wanted her to go more deeply into feelings that were extremely painful to her, and I felt like she wasn't quite ready to do that, and I wanted to give her space to not have to do that. But if you'll remember what she said, she started to move into talking about what happened. Then she moved into self-talk that she should just move on. You could almost hear the mother inside her saying, you know, stop fretting about this. You shouldn't feel this way. And I wanted to bring her back. She was being kind of vague about what happened. Ordinarily, I would pursue the particular, as Edgar Levinson used to say, and ask her to tell me the details of what happened. I didn't quite want to do that on camera, but I wanted to see if I was right that there was shame under there. That's what I found myself attuning to. So again, it's intuitive.
How did you happen to decide to jump right into this failed relationship that even evoked emotion during the intake interview?
Well, I had seen the intake interview, and I had seen that that's where her affect was. And it just seemed to me that her tears were more connected up with her inner experience when she talked about that than when she talked about other problems.
Other comments you guys might have?
I agree with Nancy. I would have exactly wanted to go back with her and get more details about what happened. In fact, I don't know if we'll show this clip, but I also asked her when I was interviewing her if we could talk about that relationship, because it was the only time that she showed strong affect during the evaluation, and she didn't want to.
Oh, interesting.
So what we did instead was to look at what fears she had about talking about it.
Yeah, it's an interesting problem where you want to talk at least in a meta way about what's hard to talk about if the person isn't ready to talk there
But it's
yet.
so important to be collaborative with the patient, and I
Yeah.
think that that's what you were doing. You were being so respectful of her and collaborative with
Well,
her.
thank you. I noticed that in your tapes too, and in Les's.
So this brings up the complexity of these tapes themselves, in that I found it difficult having the intake interview because it gave me information, but I really like it to come up from the client in the moment in our relationship. So clearly in the intake interview, this had been the most poignant issue, but the way I work is I wouldn't bring up and allude to things in the past that hasn't occurred in the relationship and here and now. So I wait for markers of to come up. So I was interested to see how you did refer back, you know, to the intake interview, although I did that a little bit. But she does seem here to, I mean, clearly it's a very important thing, part of it, and she has a lot of unfinished business and unresolved bad feelings, and then she blames herself, which is what you were commenting on. But this tension of how much can you bring out on the film versus how much is she anxious about revealing is a tension, right?
Yeah.
And how common would that be? At one point you say, you can talk about it, but I don't want you to talk about it if it's too fast.
I would
How
tend to say
common
that.
is that in your work?
Well, especially toward the beginning, I would say that very explicitly. And I probably think about this in a different language from Judy, but I would do something rather similar later on when a person says, you know, there's something I just can't talk about. I would probably say, well, let's talk about the feelings you're afraid of feeling if you were to talk about it, rather than saying, you know, spit it out, try to talk about it. But I think later in treatment, there does come a point sometimes where I would say, be brave, see if you can just say it. And again, that would be a matter of attuning to what they could tolerate.
I don't find it comes up all of that often. It does come up, and especially when people do feel a sense of shame and they don't want to say something, or they're feeling particularly vulnerable in the chair with, you know, in your office with you, and so that they might not want to reveal. But usually, I think you can pick up from their nonverbal affect, and as Les was talking about before, their tone of voice, their body language, their choice of words, their facial expressions and so forth, that there is something there. And so when I see a change of affect, it makes me think there's something there, I'll stop and say, how are you feeling right now, and what was just going through your mind? And that's where once in a while they'll say, well, I don't really feel comfortable talking about that now. And then I see collaboratively if they're willing to talk about what ideas are getting in the way of their being willing to talk about it.
Now, is labeling a feeling for the client like shame? Is that something that you all do?
I would tend to draw it from the patient, so the patient says, okay, so here was the situation, and I would say, and how did you feel? And if the patient has difficulty labeling it, I'll just give a multiple choice. Were you feeling happy, sad, worried, angry, and so forth. And the reason that I want to have a label to the emotion is because I want to hear the whole story. And it may be that the patient had a mix of emotions, and there are different thoughts that might be connected with each one of the emotions. So in order to get out the whole story, I want to really find out what the whole emotional experience was.
I think I talk about empathic conjecturing, and it's very important that it's a guess or that it's done very tentatively, and that the meta-alliance, the client is very clear that it's always in the spirit of, I'm checking and asking you to check, does this fit? So there's always that tentativeness is important, and not to receive it as this is what you're feeling. Right? But I do think that it's helpful. You can go like half a step ahead, but not 1.5 steps ahead of people. But I think it is helpful to do some offering of words to people, because it helps them recall and check, is that what I'm really feeling? So it's a kind of back and forth process where you offer them a word and they check it, and that helps carry people forward.
So that seems to be a commonality across all three of your approaches: presenting something in a tentative light, giving the patient an opportunity to take hold if it's useful to them, but to be able to say, no, that's not quite right if it's not.
It's probably a matter of balance among the three of us, so I would tend much more to try to draw it from the patient herself.
Yeah, I'm not sure I would be that different that way. I just had a strong feeling and I wanted to pursue it this time. But yeah, the tentativeness, I mean, when a client can tell you you're dead wrong and then correct you, I think it's a therapeutic experience for them.
Let's move on to our next clip, and we're going to get a chance to see Dr. Beck now work with Chi-Chi.
So we can either talk about something that you have tried to bring up in the past, or we could talk about something that you could imagine you will want to bring up in the future.
Right.
Which do you think would be more helpful?
Let me think for a minute. I guess we could talk about something that's ongoing, I guess.
Oh, that's even better.
Yeah.
So tell me about that.
Well, occasionally Mike will talk about our future together, and he'll say that he wants us to get married or live together or any of those things. And then we'll talk about it, and it seems to be a good conversation. But then the next time that I bring it up or want to say something about it, it's like we never had that previous conversation. It's gone. And so it seems it's almost like he's responding to some sentimental feeling or some romantic feeling, and he talks about this stuff, but then when I want to talk about it and want to really pin him down, it's like it never happened.
What does he say?
He just says, well, yeah, we'll talk about that later. And so that's one thing. I also feel like I haven't really conveyed to him what some of my concerns are with. I feel like he'll talk about things that he wants to see happen and is completely ignoring what I'm saying. One of the big issues
that we had in the past, I think it's not going to be an issue now just because of biology, is he would sometimes say that he wanted to have children, and he wanted us to have children. And he would, you know, he's a very methodical, logical person, and he would sit there with this very long, methodical list and go through it, and I would be responding very emotionally, trying to get him to see my point of view, and I would feel like he just did not hear a word I was saying. That he would just keep on with his list and just talking right over me while I was just screaming at him. And so I still feel like that these issues are unresolved, and I still sometimes wonder, like, does he still think that we're going to have a child? And if so, why does he think that? And every once in a while he'll say something that indicates that he does, and I go, but again, when I try to pin him down, he just skitters away. So it feels like there's these kind of big, important issues out there that couples need to figure out that we haven't. And so I think that's, you know, that's frustrating. And
now, can you wait till the next time you see him in person to have a conversation with him about these things?
Yes, yeah.
And you think that would be better than on the phone?
I think so. I think so.
You know, the phone is awful hard because you can't get the nonverbal feedback.
No, you really can't. You really
way.
can't. And it's. And we do the video conferencing, but that's not the same
exactly
either.
The same,
it's not quite the same.
And when do you see him again?
In 2 weeks.
Oh, he's coming very soon. Oh, okay. So
Yeah.
this may be apropos to that time.
Yeah.
Judy, could you tell us a little bit about this clip? What were you thinking? What were you trying to do here?
Sure. Well, as in every session, at the beginning of sessions, I ask patients, what problem or problems do you want my help in solving today? And so Chi-Chi brought up the problem that she has of getting too emotional in certain interpersonal interactions. So at the beginning of this, I was just giving her a choice of what specific interaction did she want to talk about, something in the past, something in the future, and then she came up with a wonderful one that's so important to her, which is the problem of talking to her boyfriend about whether or not they're going to have kids. And her automatic thought was, if I try to talk to him about this, I'll get too emotional. And from what she described, it sounds like, yes, that automatic thought was probably true. She would get too emotional. She had in the past. So it didn't look like her thinking was distorted, especially because she's not depressed. She doesn't have an anxiety disorder and so forth. Her thinking was, I thought, pretty accurate. And so when thinking is accurate, one of the things that we do is just go straight to problem solving. And so that's why I spent a little bit of this clip, and you see later in the session as well, talking to her about how she can talk to her boyfriend about this difficult topic. We did a little bit of role playing, things like that. So it wasn't typical cognitive therapy in that I wasn't addressing distortions. It was typical in the fact that I was doing some problem solving.
Any reaction you might have to the clip?
In general, and to this clip, I mean, I see it as very problem-solving oriented, and I would personally try to go to the underlying determinants. And I see the surface problems as manifestations, but that there's really a lot going on in her life. Now, one of the interesting things was she actually seemed to improve over the series of sessions. So she seemed a lot more integrated in your sessions. And there she did seem integrated.
You guys should do this more often.
But I think the fact that she gets so emotional is part of that. Affect regulation is one of her difficulties. And the way that I think about it is you've got to go to the underlying shame, the underlying fear of abandonment in order to help her rather than problem solving. So I think there's a type of difference between a coping focus and an underlying transformational focus. So they're working at different levels.
I was watching this for the first time and trying to think what I would have done. And I think I would have, I often do engage with patients on problem-solving issues. I might even role play now and then. But I think with this, my read on Chi-Chi is, at least at this time in her life, she is a deeply emotionally triggerable person. And I might have worked with her to try to accept that in herself more than to try to change how she could talk about something with her lover. I think I might have worked with, well, what would be so terrible if you do cry while you're talking about this? Could you just say to him, listen, I don't think I can talk about this without crying, so, bear with me. Because I think there's a part of psychotherapy that we don't talk about very much, especially in these days when the insurance companies want sort of target behaviors. But it has to do with acceptance of things that might not be so changeable so fast. A lot of what people have to do is accept who they are.
Yeah. You didn't have the luxury of seeing the whole session, unfortunately, but, and I would agree with you completely about some other patients. I didn't get the impression from her that she saw her sensitivity and her emotionality as meaning anything more than it gets in my way of doing what I need to get done. But it would be a very interesting experiment if we had 3 Chi-Chis and we all saw them for a certain number of sessions, just to see what would be more helpful and less helpful.
But if I can just comment on that, I mean, I see her seeing her distress emotions, which I would say are secondary phenomena getting in the way. But she doesn't ever deal with her primary emotion, which essentially is shame, which is what you were picking up, and also fear of abandonment. And then she has symptomatic emotions, and she feels angry, frustrated, and she gets upset. But the issue is that, and then she reacts and kicks herself for having those emotions. But the issue I would see is how to get to the emotions that she's actually not addressing, and that kind of avoidance of what she isn't addressing.
And, and again, we need to do an experiment, because it may be that what you're saying is 100% accurate, and that really, if I were to work on a more superficial level, it just wouldn't work with her. On the other hand, it may be that she's a pretty well integrated person who's accomplished a lot in her life, but still has some specific goals that she wants to meet, and that we might be able to do this in a much more straightforward way. The advantage of assuming that there's a more straightforward way is that you can get very quick symptomatic relief. Here's, all of our patients come in to see us because they're suffering. If we spend a lot of time in transformational psychotherapy, which I think is very helpful for some people, then we don't teach them the coping skills they need, or that they could benefit from, to start feeling better right away.
Well, I probably disagree with you on that. Not about the importance of coping skills and such, and I do sometimes work with people on that, but I don't see the evidence that symptomatic relief is faster with looking at problem-solving behavior than it is with standard kinds of emotionally oriented psychotherapy. I don't think we have the data on that. There's an assumption that it is, that people stay in therapy for years, so we must be able to do it faster. But in my experience, people stay in therapy for years because they're getting something from it, and they started getting something from it very early.
But I do think the research shows that there are certain evidence-based practices and approaches where patients have maybe 8, 10, 12, 20 sessions, and the Axis 1 disorder they came in for is resolved by the end of that time.
Yeah, that's true.
I think things are a little different, though, when we're talking about Axis 2 patients.
Now, I noticed that when you began this clip, you asked her if she wanted to work in the past or kind of in the future. Is your perspective important in terms of whether you work past, present, or future?
Well, I almost always start in the present. What problems are you having today that you need some help in solving? How can we help you feel better by the end of this session? How can we help you go home and have a better week? And so I would stay in the present until we got stuck. And this usually only happens with Axis 2 patients. And then we might need to go into the past to see how certain beliefs about themselves and others in the world originated and how they got maintained, but also then what happens today. And we're always future-oriented. What are your goals for treatment? How would you like to be different?
Is that similar with your approaches?
Well, I would say I'm working in the present, but I'm bringing the past into the present a lot. But I mean, you're always working in the present.
Yeah.
So the distinction sort of breaks down a little bit, I think, so that I am saying even the future exists in the present, so that it's your present experience that's important. I mean, I make this distinction much more between conceptual experience and bodily felt experience. And I think you can work conceptually in the past and in the future, but when you work experientially, it's happening always in the present.
Yeah, I would agree with that. I mean, I stay in the present too, but I often ask the patient, how do you understand this problem? What's your understanding of it? And that always takes it to the past. Or when I'm working on their sense that they're in a conflict and they're resisting some change they know they should have, I say, what's going on? It goes to, well, my parents told me this or that. So the past comes in, and certainly we look toward the future. What would you like to see different? But I think I similarly stay in the present.
Now, you've each had a chance to watch one clip from the other's work. Any thoughts or feelings that you're having right now?
Well, I think there is a real difference between a coping and problem-solving approach and our two approaches, which are more depth-oriented. And then I think the difference is that I use more active techniques, maybe,
Yes.
than does Nancy.
Yes.
But the sort of focus is very similar. And then
Okay, so maybe our viewers will see that in the next clips. Yeah. Any other
Yeah.
thoughts?
It's interesting. It does sharpen up the difference, but behind that I also see some, there's a therapeutic presence that comes through with all of us.
With all three.
But it's interesting that I think we do start from different assumptions.
Yeah.
So my assumption, for example, is what do we do to get this patient feeling better as soon as possible? What can we do today to get her feeling differently? And I think that obviously it's a slightly different focus if you're doing more in-depth therapy, which is something I
be
would do with
encouraging them to grieve more and assuming they'll be feeling better that way, rather than to help them change how they're behaving so that they get a better outcome.
Now we're going to go through some more clips, and we'll do it in the same order. So why don't we start with the next clip of Les's?
Tell her how she's not that good anyway, or why it won't succeed. Because there's sort of two parts. One is you'll not get it done, but the other is you're not good enough. So what do you say to her?
You're just going to be exposed for the fake that you are.
Yeah.
You're not. You're going to give it a half-assed effort like you always do. Give it up.
So you'll never, if you try, you'll fail.
You'll fail.
Right. So don't even
bother.
Don't even bother. Don't get to it. Yeah. Does that?
That's
What you do.
Yeah.
Change, if you will.
Okay.
What's it like when you get that? I mean, already the tears have come, but what's it like when you get that message?
You're right.
Yeah, yeah. But what's it feel like inside? Yeah, breathe. And really go to you, because what does it actually do to you?
It makes me feel small.
Yeah.
Small and helpless.
Yeah, yeah, yeah. And this is the painful feeling.
Right.
Let's try and stay with that, right? So tell her I feel small.
That makes me feel terrible.
Yeah.
It's
And then,
not true. It's not true, and I don't know why you're saying it. But we both know that that's not true. And maybe you're right to a certain extent, but I don't know. I can't, I don't have anything to say to it. I don't.
And what do you feel as you sit here?
You're right. I mean,
It sort of feels hopeless, or
Yeah.
you feel
yeah,
like giving up.
yeah.
Tell her what it does to you. It makes me feel.
Well, now I feel like I have no reason to make any effort.
I feel like, what's the use?
What's the use?
Yeah.
What's the use?
And then I just kind of retreat
Yeah.
almost, or kind of.
I don't want to have this conversation anymore, so we'll just drop it. I don't want to hear it anymore, so we'll drop it, and I just go away.
Talk about the
would just
going away. What does going away mean? Like, just.
In my mind, I just walk away. I just go away from it, distract myself
Yeah.
from it.
Yeah. Yeah.
Les, can you comment on this clip? I'm especially interested in how you use that empty chair technique to kind of externalize this internal dialogue.
Right, and there's a lot going on technically here, because firstly it's like getting the right negative automatic thought, or which is you'll be so exposed. And it begins to get at the subtlety or differentiation of some of her internal process. And then when she goes to the other chair, in some way she says, you're right. And the goal in this dialogue is eventually to get another voice, not a voice of agreement, because this is to try to get the affective experience. And so the chair dialogue has nothing to do with, is it true, is it correct, or whatever. And this is where I think it differs from a cognitive approach. It's actually to get at the underlying feeling. And it may seem paradoxical, because I'm taking her into the feeling of it's hopeless. And, but yet it's based on this approach that really the only way out is through, and that you have to feel something in order to heal it, and that you have to go into it. And she gives us such a beautiful example of how it's a dreaded feeling, and she just withdraws and pulls away from it. And that's what's happening in her automatic processing in real life. And this is where we're trying to get a change, because as she begins to be able to approach it in the session with the support of a secure therapy relationship, she'll slowly begin changing her automatic processes. It's got nothing to do with deliberate reasoning or even with cognitive understanding or intellectual insight. It's got to do with actually changing her behavior in the session, where she can approach what she previously avoided and find that she survives it, because it is so dreaded. And when she says, I just go away, it's so poignant, and it's in her voice. I mean, it's really catching the struggle and the pain that she experiences. And when I said before she was maybe not so integrated, I mean, we're all not integrated, but there's a lot of pain. There's a lot of pain. And I think that pain needs to be addressed.
You know, and it's interesting because if she had had an avoidant personality disorder, I probably would have done something more similar to what you did. And because she probably would have been not only avoiding moving ahead in certain areas of her life, but she would have been avoiding even thinking about moving in those areas. She would have been avoiding negative emotion. I didn't see her as someone, though, who avoided negative emotion. I feel that she really allows herself to experience it, and that's why I would have just worked at a different level.
I did feel that she avoided the depth of the shame, and I thought that the sense of being exposed was part of that. I have to say I loved watching this, because I've never watched the empty chair technique especially as done by a master. I've heard it described. I tried to do it once as the patient. I didn't like it. And I remember back when Pearls was talking about it in the late 60s, early 70s, I thought, that's just too gimmicky. I would never go there. I couldn't integrate that with my sense of myself as a therapist. But I was fascinated to watch it done by an expert and to see what came out when you did it. And I think what came out would be what I would be looking for through more traditional means, but I'm struck by watching a master at it.
Now, in this segment, Les, there's some ways in which what you're doing is much more coaching-like, a little bit like what Judy does. Can you say something about that part of it?
Yeah, I mean, I do talk about emotion coaching, which is a combination of following and leading. But it's, I would see it as, not kick in the pants coaching. I mean, it's very subtle because I'm really saying attend to this, attend to that. And it's like what I said before, you can be one step ahead or half a step ahead, but not 1.5 steps ahead. So I think there is some guiding. I think that's the best term to use. And there is a coaching element to it. And the coaching is always to try to help you take the next step in this moment. So it's very attuned to the moment. It's not goal-directed. It's marker-guided. And the goal is to get you to experience more deeply. I mean, that's what I'm coaching towards.
Now, I'm sure some of our viewers are watching the three of you work, and they're noticing that Judy takes notes, that she's got her pencil and paper out and is writing, and the two of you don't. You're just use more your present without taking notes. Can you talk about that? Whoever, I mean, I don't.
I actually do sometimes take notes in sessions, often until I sort of feel my way into the affect. But I don't do the kind of writing down and sharing it with the patient that you would do. I keep it for my own records.
And I always take notes unless the patient is getting really emotional, or unless I feel as if taking the notes is interfering with the immediacy of our relationship. But I am taking notes, and I'm taking notes for the patient too. So I send the patient home with notes at the end of every single session, because there are things that the patient learns in every session that I want her or him to practice at home. Different ways of thinking, different things to do. And I find that taking the notes also can help slow down the session a little bit, because, and I thought we were all pretty good at the following, which is using the patient's own words then to spur them to go a little bit deeper or a little bit further. And so when the patient says something that I think is very important, then I'll write it down and repeat that.
I know your answer, because whenever I see you, you want to borrow a pen.
Right, so I would see two main things. A, I give primacy to the relationship, even above emotion, so that I feel face-to-face communication is crucial. And Levinas, this French philosopher, talks about the demand in the face of the other. The face of the other demands a response from us. So writing would be totally distracting for me. And I think there's a lot of right hemisphere to right hemisphere communication going on. People are reading your face. And the style of relating is very different. I mean, it structures a different relationship. That's what I'm really saying. The second part is I am not aiming for information. So anything written down on a piece of paper isn't an experience. Now, I do think it's important to symbolize something conceptually at the end. And I think in that way, it's helpful. But the goal is the next moment of experience, so that the information on the piece of paper isn't really what I'm aiming for, because that's not that kind of change that I'm aiming for.
Well, let's move on to our next clip. It's Dr. McWilliams again.
Here's what I am putting together from what you've said so far. That growing up, all kinds of decisions were made for you by other people.
Right.
You had no say in it. You just had to cope. no opportunities to develop your own sense of agency, of having control over your own life. And when you hit your teenage years, you determined to live your own life with a vengeance
Right.
in a way that was self-destructive, but at least it was your self-destructiveness. You were in charge of it.
Right.
And so I find myself not surprised that, A, you let other people influence you a lot, because I think there was a disturbance of your sense of agency. And in a way, it's a repetition of, listen, everybody else knows where you should be.
Right.
You should leave the guy. Or
Right.
we're moving.
Right.
And the only way you could feel your own sense of agency in that situation was to precipitate exactly what the loss was that you were afraid of. It's like a kind of acting out.
Right. Right.
But at least you did it. I mean, in some ways, I think one of the consequences of your history is that you can feel your power mostly in opposition to someone else's agenda.
Yeah.
And when you're headed toward the finish line in whatever it is, and you start feeling that some other agenda is now controlling you, you may need to throw a monkey wrench into everything. That's how I'm putting these
That's
things
interesting.
together.
That's interesting. Yeah. That's. Yeah. I think that's. I think that's what it is, and I think, but. I don't know, because what am I opposing now? You know what?
Yeah,
You know?
well, the unconscious isn't so rational.
Well, now, okay.
We do find ourselves, and that's really what you came in for. That you keep enacting something that doesn't make sense, and you're saying to yourself now, why doesn't it make sense? But in a way, it made perfect sense in your family of origin. That really was the only way that you could feel like you were living your own life.
But why couldn't I have done that in a way that was more constructive than destructive?
Well, you would have needed some help from the adults in your life to give you a slowly developing sense of agency, including maybe things like saying to you, we do have to move, but let's figure out what would be best for you given that we have to make this move. I mean, I think your mother with 3 kids probably couldn't sit down with each one and do that.
Right, right.
But some parents will very carefully do that. I know you're miserable about moving, but at least let's talk about how you want us to paint your room.
Right.
Whether you want to go to the public or the private school,
Right.
let's think about those things. I mean, that's how you help a kid get a sense of agency.
True.
Nancy, this is an extended interaction, and you seem to be attempting to do several things. Could you talk a little bit about that, and did you get what you were expecting?
I guess I got what I was expecting, which was she kind of took it in intellectually. And I'm struck by this is probably the most I talked in the whole tape. And it came out of my sense that if I'm developing a formulation about a person based on a kind of set of psychoanalytic ideas about the development of, in this case, a sense of agentic selfhood, I want to share that with the patient and see whether they are on board with the way I'm thinking about it, see whether that surprises them or whether it's something they've thought about or whether it's something they say is wrong. So it was a more intellectual part of the treatment, but I feel we owe it to people to give them some knowledge about where we're coming from And that was what I was starting to put together. Chi-Chi was a diplomat's daughter. She moved a gazillion times in her formative years. She had no choice about it, and she had no responsiveness to her pain about it. And I think she minimizes that because to her, that was normal. That was just life. So I was trying to make it a little bit alien for her, to think about it as if she were looking at a child now with that history, as opposed to, well, of course, that's just the way it was. So I guess you could say I was trying to make something that she thought of as egocentric, ego-alien, to use the old language.
The rest of you have some thoughts about
I
this?
thought the way that Nancy conceptualized it really made sense. My technique would have been just more to draw it from her, or to perhaps even use the same kind of conceptualization, but ask it more in a question form. So, what do you think of this? Or, I have an idea, I'd like you to tell me whether you think I might be right about this or wrong about this. On the other hand, I would be more likely to take a current situation in which she's feeling out of control. For example, not being able to get herself to work on her writing, and to ask her, well, what is that? What are her thoughts about that? And what is the meaning to her? And we probably would get back to this idea that she may have a basic belief that operates some of the time. I don't think it operates most of the time, but that she's a little bit helpless, she's a little bit out of control. And we may have spent a little bit of time talking about where did that idea come from, so we can say, well, no wonder you have this idea about yourself. Can you see that, almost any kid in this kind of environment might grow up to believe this about herself? Okay, so now what are we going to do with it? And then the focus would have been on the present.
One thing that stood out for me was your facial expression, and this picking up from the previous commentary, because when you expressed the sense of lack of agency, you actually communicated a type of assertiveness with your face, which was the assertiveness that she didn't have. And you were sort of like her advocate, for you really deserve to have this kind of thing. And I was just really struck with, how much goes on at that nonverbal level.
Interesting, yes.
And throughout watching yours, I was amazed at how you were able to non-judgmentally put out some fairly strong interpretive comments as I saw them. And I too, agree with Judith that I would have tried to draw it more out. But I was struck how you're engaged in narrative reconstruction with her, talking about making it ego-dystonic. Of getting her to see it in a new way. And my goal would be to get there at the end, but the process would be for it to come from her, and then at the end to be able to crystallize it in that form. But you were giving it to her, and in a masterful way such that she receives it, whereas I could imagine those statements being given in a way that would get some kind of resistance.
Well, I also think I should say, in the interests of honesty, that I think my worst quality as a therapist is the flip side of my best quality as a teacher. I find myself lapsing into roles of trying to teach someone. I think I do it empathically, but I think I keep it as a goal to do exactly what both of you are talking about, that it's better if it comes from the patient. And yet I can't stop myself sometimes. So.
Now, Judy operates from a model that's called cognitive therapy, but I noticed that both of you are really working pretty directly with cognitions as well. Can you speak to that?
Yeah, I think that's part of the psychoanalytic tradition I was trained in, impulses, affects, cognitions, behaviors, sensations, they were all talked about. And I think part of the difference between me and Judy, I would guess, but you can correct me, is I put more emphasis on how some of those cognitions are really pretty deeply unconscious. And I think the idea of distorted or irrational beliefs assumes more accessibility to consciousness.
I think you're right about that. And in cognitive therapy, we find that just by asking for the meaning of their thoughts, we're able to get down to rock core bottom, these ideas that Chi-Chi might have, I'm helpless, I can't get myself to do things, I'm out of control. And that we can get to it quickly by asking for the meaning, and we don't have to assume that there are unconscious meanings that she's not able to come up with, for the most part.
And I see that, firstly, cognition is a very complex word because really emotion is filled with cognition. It has attention, it has perception, and the word cognition has become a catch-all that's become meaningless in my view. So that thoughts and beliefs are not explicitly the only cognition. So I use cognition all the time, especially attention and attentional allocation. Pay attention to your body is cognitive because you're paying attention. I prefer to talk about working with meaning and with narrative. That's what I think is the complexity of human nature, is that we're strongly meaning-creating beings. But you know, there's a sort of different direction. I do think things are far more automatic and not conscious, and then that there's a form of lived experience that is not in language, and that the brain talks through the body in an affective language, and that the goal is to put symbols to make meaning from that bodily experience. So it's a different view of cognition, but I work with meaning all the time.
You know, each of you have talked in different ways about, you know, what you're trying to accomplish in a given session. And you've talked in different ways about what you want to accomplish by the end, what you want to register and store in memory. Could you talk a little bit about how you try to do that?
Well, I think I do it probably pretty directly. So the patient comes up with the idea, as Chi-Chi might, I can't get myself to start on my writing project. So then we look at the evidence that that's true or not true. It looks like it's pretty true because she hasn't been able to up till now. And then there's really a question of whether the focus needs to be on going deeper with that and really looking at this helpless idea, or whether to be more problem-solving oriented. But by the end of the session, we have a plan that I want to have in writing for her to be able to carry through.
I would see that when somebody comes in with a symptom or a problem, that they are not suffering from skill deficits in general. I mean, some people might, and I would make that kind of assessment, but that generally I'm looking for the underlying determinant. And I think that's sort of with the clarity and sureness and confidence with which the therapist can capture the kind of chronic underlying pain, that then we get to agree to work on that underlying pain that is leading to the symptom, or that the symptom is a manifestation of. Because I think the problem with working directly on the symptom, I mean, and with Chi-Chi, is she talked in the intake interview about all kinds of problems in her life, an anger problem, a drinking problem, a relational problem. And usually these problems go across situations, across experiences. And so I'm looking for the sort of core underlying determinants and then get an alliance to work on that. And I think the difficulty with my session with Chi-Chi was because it's all happening so quickly and in a demonstration therapy, which is different to what you do in an actual therapy, you know, we didn't actually get a clear collaboration on that she wants to work on or sees the relevance of working on this core shame from the mother and the abuse and so on. But in a normal therapy, I would be working towards getting at agreement on that as a goal. And the goal really is to work on the chronic underlying pain.
I think the main thing that I work on, at least in the early sessions, is trying to develop a sense of safety. Because I'm often stunned by how much patients withhold from us, how they may take 2 years to tell me that they're not having sex with their husband, for example. And I want to keep checking in. Are you feeling safe saying everything, showing me everything? So I will tend to check on that a lot. I think a lot of the therapeutic power of any given session is a patient's sense that I could be fully who I was, or I could approximate being more fully who I am safely with another person bearing witness to this. So that's where I would be coming from in a general way.
Right, and I just want to piggyback on that. I mean, I would say that's my goal as well. In the demonstrations, I'm demonstrating the more active aspect, but I think the relational safety is the sine qua non, because you can't really get to the deep emotion without that safe relationship.
I mean, in the contemporary language of attachment theory, you're creating a secure base.
Yes.
And if the person has insecure attachment, you're trying to slowly help them to develop more secure attachment.
And in cognitive therapy, as in every psychotherapy, the therapeutic relationship is paramount. If you don't have a good, safe, sound, trusting, collaborative relationship with the patient, the patient's won't probably join with you, won't engage fully in treatment with you. I've not had a problem, though, with most patients in developing this sense of safety and trust. One of the things that I do at the end of every session, which I think is helpful in this way, is that I ask the patient, what did you think about the session? Was there anything that bothered you? Was there anything you thought I got wrong? If there were, would you be brave enough to tell me? And so I address a potential problem right away, and I do that at the end of every session until I really feel as if we
But I
are
think
fully
there is
engaged.
a different kind of relationship that you set up, and it's much more distant. Well, I mean, that's not exactly the right word, but it's more of a rational type of relationship, which is more, you know, we're doing this and it's working together on something.
Pragmatic.
Pragmatic, as opposed to a face-to-face intimate relationship.
Let's see if we can
They're
see
different
that. You know,
styles, I
it might
think.
be apparent in the next clip we're going to watch, which will be our final clip with Dr. Beck. Let's go to it.
The way that you presented it before is certainly a reasonable way to present it, except that you come across as a little bit angry and critical of him. So just another way of approaching him might be to say, I'm really confused. Because it's obvious to me that you've wanted a kid, or you've had positive feelings about having a kid for a number of years, and I haven't wanted to. And I thought that I had made that really clear, but I'm confused as to what's in your mind and whether that's still something that you think is going to happen. And then, how do you think he would react if you said it that way?
I think he would probably say, what would he say? He would say, well, what are your reasons for that you think that you don't want to have a child? Or that you don't think you can have a
See,
child?
Mike, I'm a little confused because I feel like I've gone through all of the reasons before, and I feel like you think, gee, if I can't, Chi-Chi can't make a case for this, then we'll have a child.
Right.
And I have to tell you, just in my heart of hearts, I love you, Mike, and I want to stay with you, Mike, but I just don't think it's a good idea for us to have kids. And you're just not going to win me over.
Right.
And then what do you say to that?
What would he say? I don't know. He would probably say, he would probably say, well, let me hear all of the objections and I will provide a solution for each of those objections. That's his way.
Yeah.
If you say, I don't want something, I don't like something, his way is to say, well, give me all of your objections and I will come up with a solution for each one.
And out of role play, Chi-Chi, do you feel like you've already done that?
Yes.
And there's just no way he's going to...
No.
And so then I think you have to say, Mike, just any amount of logic isn't going to change my mind on this. I'm really sorry. I mean, I wish I could go along with you. I can see that this is really important to you, and I like to make you happy, and I wish I could do this for you. But
that would be a good way to phrase it.
But I really can't.
Yeah, I think that would be a more constructive way to phrase it than what I have been doing, which is to, you're not listening to me. But
and what do you think he would say?
I think then he would probably hear it, and he would. I think he would hear that, and he would.
understand that to some level. I don't know what he would do after that. I don't know. Part of my frustration with it is that I think that he has been in long-term relationships in the past. He had 2 long-term relationships before me. My feeling is that people who want to have children do that, they know that, and they do that pretty early in their life. So why didn't that happen with those? Well, in fact, I know in one case, it was the woman who wanted to get married and have children, and he didn't.
And he didn't.
So part of me wonders how much he really does want this.
Yeah.
Because I think people who do want children know it early, and they plan their lives that way.
That may be, or for any reason, but in any case,
Yeah.
I'm not sure how relevant that is
Okay.
if this is something that's so strong inside of you.
Okay.
Now, are you fearful that he may want to break up with you?
I am.
And would you tell him that? Mike, I'm really afraid you're now going to want to break up with me.
Judy, can you comment on your work in this session?
So in this part of this session, she specifically asked for help with telling her boyfriend that she doesn't want to have a child. And she's approached this before. She's been frustrated. She feels as if he doesn't really hear her. He brings it up as if they haven't had the conversation before. So in this part of this session, I'm just doing a role play with her. Now, I guess the first thing I did was to ask her, in this next time you talk to him, what would you like to say to him? And she came across with something that was okay, but it was really kind of angry. And I thought, boy, if I were in Mike's shoes, I would really be taken aback by this. And if her goal is to have Mike understand her, perhaps she has to approach him in a different way. So then I said, is it okay if we do a role play, and I modeled to her what she could say, and then was looking for what reaction might he have back so we could continue the role play.
Yeah. Comments you might have?
Again, I sort of was tuning in on you're staying at a very intellectual level with her, but at the very end, you got to the thing that was hitting me between the eyes in the clip, which was I just identifying with her. I thought she's terrified that if she really gets her point across, that this is a real firm no, he will leave her. And you did get to that by the end. But
and then we actually then talk about that for the next segment. And it's very interesting because what she comes up with is, if I lose Mike, I'll never have anybody else. Not because there's something wrong with me, but that there's something wrong with my judgment that I'll pick bad guys again like I did when I was in my 20s. So then that was a distortion we could really work with.
okay, and I would have gone to a very different direction. I would have gone to the conviction that she had internally that, like the other people in her life, they were going to disappear on her. And that, of course, is a possibility. If you tell a man who deeply wants children that you're not going to have children, that is something you'll have to face. And then I would want to communicate that if the worst happens, she could probably bear it. But I think I would go more into the affect about the fear. I think it's based on deep stuff from her childhood. She was separated from her father for months at a time as a kid.
On the other hand, she has approached this with him before, so it's not as if she's avoided this topic.
Well, yeah, but she hasn't approached it in a way that's gotten him the message absolutely clearly
No.
that I am saying a flat no here. And I think there's a reason for that. I think she's terrified to be that definitive.
It seems like you guys are already doing this, but how about some comments and questions about each other's work to each other right now in the program? What thoughts, comments, questions might you have?
I'm not sure. I mean, I have a statement which is, you know, and it's tying off this. I mean, I think I don't have the assumption that people sort of have a deficit and that you can coach them to do things better. You know, this is the basic assumption, and it's more like that there's some deep kind of affective process that's blocking them from doing these things. So that's always just a kind of difference. But I understand, I mean, if you can coach her and she approaches the boyfriend differently as a function of this session, And if you're there the next session to help, that eventually things in the world might change for her, and there'll be a kind of change because there's been an external loop change, you know, what happens in the world. I'm working in a different way, that internally there's an anxiety, a block, a sense of shame, and that as soon as anxiety rises, her behavior is no longer under her conscious, deliberate control. Her affect will take over. And that somehow we've got to work on that, so that eventually she's able to talk to the boyfriend in this way. You know, those are the different assumptions, I think, that we're working with.
And in that area, I find myself often identifying with what Les says. I think I sign on to the psychoanalytic idea of how inherently conflicted we can be, how complicated we are, how sometimes just holding a paradox is more important than solving a problem. You know, some parts of life are paradoxes to be tolerated rather than problems to be solved. So I think that's a temperamental quality as much as a theoretical quality. I think I'm attracted to a theory that talks about our brokenness, our conflictedness, the depth of, I mean, my colleague Stan Messer wrote about, who's very respectful of cognitive behavioral approaches, wrote about them having a more comic vision, not in the sense of comedy, but in the sense of things are going to come out if you change your behavior. And the psychoanalytic people having a more tragic vision that, you know, life is really difficult and we can be there to help each other bear it, you know. So I think that is a temperamental difference perhaps between us.
You know, and I think what's similar to us is that we all want to help people decrease their misery. By the end of treatment, we want them to be functioning better, we want them to be feeling better. And some of this has to do with, well, it all has to do with how do we get them there. And I think just cognitive therapy takes a much more direct approach until proven otherwise. So let's do the problem solving, let's teach you how to think more clearly, let's help you correct the distortions in your thinking, let's figure out what your goals are, let's figure out how to get you there. And doing that with many patients is enough, and then they feel better and they stay better. And with other patients, particularly ones with Axis II disorders, it's not enough, and we do have to plumb the psyche a little bit more. We do have to go more back into childhood.
Well, I think we've done a great job today in terms of talking about similarities and differences, and I hope our viewers have enjoyed everything that they've seen. They saw 3 great examples of psychotherapy. They watched this whole series from end to end. Thank you very much.
Thank you.
Thank you.
Chi-Chi, it's nice to see you again.
Good to see you.
We've kind of gone full circle. I did the initial intake, and now this is an outtake.
Okay.
And what I'm interested in is to try to find out what your experience was like with the 3 therapists that you saw as a part of this program.
Okay.
And the first question that I was really wondering about, if you had some friends and they were going to start therapy, and they were trying to decide who should I choose, Dr. Greenberg, Dr. Beck, Dr. McWilliams. How would you describe the 3 different therapists to your friend?
I would say that each of them focused on, I would say, almost a different part of your personality, and what part of that personality you feel would respond better to their approach. Whether you feel that you need work on really identifying your emotions, or it would depend on. I think that's how I would sum it
So
up.
if you needed somebody, they wanted to work on emotions, who would you suggest they talk with?
Dr. Greenberg.
Dr. Greenberg. Okay.
But each of them, as I said, each of them, I think, are really focused on a specific part of, if your problems have a lot of components to them, each of them really focused primarily on one of those components. So it was interesting in that way.
And so as you leave, having been in these 3 sessions, what are you taking away with you?
I was actually surprised at how different my response to each of them was, and how different it felt doing the therapy with each of them. Going into it, I didn't expect it to be that different. I thought it would be sort of I thought that my emotional experience of it would be similar, but it was very different.
And can you talk about the difference? I mean, you began with Dr. Greenberg, and then you went to Dr. McWilliams, and then Dr. Beck.
Right. You mean talk about how I reacted to each one?
Yeah.
With Dr. Greenberg, I really felt that there was a very strong emotional connection right away, and that it was a very safe place to really talk about anything and to really identify emotions and make them controllable. And I thought that was, it was so focused on that, and it was so, that you wouldn't think that that would be, intellectually you would think that that might not, how would that be helpful? But experientially it was, you really felt removed from everything and just very focused on that stuff. Dr. Beck I liked a lot because the idea that you could take charge of things and not ignore the emotional component, but put it aside for the moment and focus more on changing your life and taking concrete steps. It was very hopeful and very, it was very good to have that sense that you could be in control. With Dr. McWilliams,
yes.
I'm sorry. I was very impressed by her intelligence and her ability to very quickly analyze my confused emotions, and that was very helpful. I was impressed by the fact that she had taken the time to read about something that I had mentioned in our intake session. When I mentioned that book, she actually took the time to.
That meant a lot to you.
Yeah, that was impressive, and it as far as her therapy, I felt like it didn't have that same sense of emotional safety, maybe, as the others.
Yeah. Now, you described seeing them, 3 consecutive therapists, as
Right.
opposed to maybe one therapist for 6 times.
Right.
Can you talk a little bit about the difference that created for you?
Well, it was interesting that I came away from each one feeling better and more hopeful, but in a very different way. I think probably of all 3 with Dr. Beck, I felt that I would start feeling better more quickly, that I would start feeling resolution and solution to my problems more quickly. With Dr. Greenberg, I felt that it was a safer, a place where I could talk about anything. But with both him and Dr. McWilliams, I felt that the therapy would end up being a longer process.
Did you see yourself any differently when you were in the sessions with each of these 3
Yes.
therapists?
Yes, I
Yeah.
did.
Can you talk about that?
Yeah, I think they all made me see a part of myself that I maybe hadn't been aware of, that that I had more agency, more personal agency than I felt like going in, and that was even after just 1 or 2 sessions.
So there's some hope that you had?
Yes. With all 3 of them, I felt that.
I see, yeah. And so as you walk away from this experience, can you share with our viewers what you take?
I think that there really is a difference in approaches. Again, something that I think is almost hard to really know until you experience it. And I think that everybody, I think that probably any kind of therapy probably can help someone if the therapist is, I think just the act of talking to someone who is non-judgmental
Yeah.
and maybe points you in a different direction, whatever their actual approach might be, would be helpful. I also think, though, that it probably is useful for people to think about what actual approach they think would work for them.
So a fit of therapy and client is really important.
I think so. I think
Yeah.
so.
Okay. Are there any other final thoughts that you might have for our viewers?
One experience that I had with this was my emotional reaction to having this kind of intensive therapy over a few days like
Yeah.
that. I think I had a delayed reaction. For the first 2 weeks afterwards, I didn't think about it. It wasn't. And then about, I want to say about 2 weeks later.
After you'd seen all three therapists?
Yes, after all the taping was done and so on. I had a very strong reaction. It suddenly started to hit me that I had gone through this and opened up to these people, and I had a real sense of anxiety, and that I felt like I needed to have some resolution to that, because everything had been opened up, and now it was just free floating out there, and there was no place for it to go. So that was one thing that I noticed strongly.
So you would have preferred to have just kept going with someone?
I think that would have been helpful. Yeah, I think so. Even if at the time I didn't think so, but then it hit me later. So that was interesting. And I guess I would say just, I mean, not everyone has the luxury of choosing what kind of therapy they and what kind of therapist they choose, or they end up going to. But I think that it can be helpful irrespective of that. Perhaps it might take longer, or it might not seem to be going the way you personally want it to. But I think, yeah.
Just for one, final question that I would have is, when you began this process, you wanted to focus on following through on things, I
Right.
believe was the
Yeah.
term that you used.
Yes.
Any insights into that?
I did find myself using some of the things that we talked about, and thinking about some of the things that we talked about. And I still think that it's a work in progress. But
Aren't we all?
yes,
Yeah.
I think we all are. But yeah, so that was it definitely had a very beneficial effect, I think.
Well, I want to personally thank you for myself, as well as for the therapist and our professional community, for sharing with us and allowing us to learn by your openness. Thank you so much,
You're
Gigi.
very welcome. It's been very interesting, very enjoyable.
As we near the end of our program, Gary and I would like to take this time to formally thank Chi-Chi for her participation. It was through Chi-Chi's sharing of herself that all of us have been able to learn.
And we also want to thank our therapists, Doctors Beck, Greenberg, and McWilliams. We appreciate their willingness to participate in this live, unscripted, unrehearsed demonstration.
Now that you've watched 3 approaches to psychotherapy, the next generation, we hope you've enjoyed the program. Again, we'd both like to caution you that the purpose of this program has not been to identify which approach is the most effective, but rather to see 3 effective approaches in a side-by-side fashion.
We hope the spirited debate among the therapists has helped to illuminate the similarities and differences among their approaches. But John and I and all 3 of the therapists share one goal in common, and that is helping people to live happier, healthier, and more fulfilling lives.